this started. So Representative Bean, if you just would get yourself ready to take a roll, you may need to do that when I get through reading this. As chair of Division 3 of the House Finance Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 is extended, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I'm confirming that we are using Zoom webinar for this remote meeting. All members of the committee and staff of the state agencies with agenda items have the ability to communicate contemporaneously during this meeting through this platform. The public has access contemporaneously to watch and or listen through this Zoom or alternatively through a phone and following the directions and links that have been provided in every House calendar since House Calendar 8, and they're all listed on the Gen Court webpage. We have previously given notice in those House calendars on how to listen in via the telephone. We've stated that if you have trouble accessing this, you should email us at lba_fiscal, FISCAL, at leg.state.nh.us. And if you email us letting us know that there's a problem, we will adjourn this meeting and reschedule it. Please note that if we take a vote, that it'll be by roll call. And I don't see Representative Weiler yet. He will be here. But if you would, Mr. Representative Bean, go ahead and take an attendance. And when the member states that they're here, please let us know who else may be in the room or house with you.
Representative Wallner.
Mary Jane Wallner. I'm at home in Concord and I'm home alone.
Representative Nordgren.
Representative Nordgren here in Hanover in my dining room / office, and I'm alone. Thanks.
Representative Rogers.
Catherine Rogers. I'm in Concord in my apartment and with my dog Romeo.
Representative Edwards.
Representative Edwards in my home office in Auburn. I have other people and dogs in the house, but my door is shut. They shouldn't be coming in.
Representative Ura.
Present, home alone in my home office.
Representative Weiler. Not here yet. I'm Representative Bean. I'm home in Guilford. My wife's in the house here somewhere with my dog.
Okay, so thank you. One of the documents that got worked on over the weekend and should have been sent to all of the committee members, I believe all of you, but maybe Representative Bean has acknowledged receipt of this. It's a Word document that I labeled as Division 3 March Madness. Remembering back in the day when there would actually be basketball tournaments with people at them. So our March Madness is the sprint to completing our budget work on the 24th. It's in a calendar format that I adopted from what Mr. Ripple gave us a while ago. And if you could pop it open, I'd like to just walk you through it just a little bit. So for example, you'll see that today we have scheduled the closeout of the public health services, and then we'll hear about the Veterans Home. And this afternoon or this morning later, I'd like to get us to talk about Section 22 of the HB2, see if that's ready to approve. Then we'll have Representative Wallner, who has put in a lot of extra work over the past several days, to include the weekend, to talk to us about Section 39, the Forensic Mental Health Hospital. Representative Wallner, will you be ready to do that today, ma'am? I don't want to put you on the spot.
I think so. I'm just gonna ask, I will send Kevin an email. I just had a couple of things that I would ask Kevin maybe to put up as a screen share.
Yes, ma'am. And then you'll note, if you're looking at the March Madness calendar I sent out, that I put on Thursday of this week that we would finish section 39. So we're not under any pressure to today to decide. It's just
Great, thank you.
you're telling us what you got, and then we'll decide on Thursday.
Okay, fine.
Then I'd like to get some input on how we can do a quick sort on getting past the portions of the budget that we have, basically violent agreement about, and so that we can set it aside. And then Mr. Ripple and Mr. Felstad, as I understand, there is a tremendous amount of work. Every time we change a number anywhere in the accounting system, it has to manually be gone and over and typed into the system. And obviously that's prone to error because you have humans doing it. So there's a lot of time spent making sure there's quality control too. So we want to give them as much of that sort of clerk entry work as early as possible so that they can move beyond it. Now, Mr. Ripple, I just described your process. Did I describe it semi-accurately? What would you add so that we know how onerous a task that is?
I do think you described it very accurately. So basically any change that you make, we will need to go in and manually enter on both the expenditure side and the funding side. So if an item is funded by a mixture of general funds, federal funds, and other funds, we need to manually enter in each one of those. So it is quite a long process. And you're right, at the end of it, invariably there will be mistakes. I don't think I've ever done it without mistakes, and we'll have to hunt those down and make any necessary changes. So depending on how many changes the committee decides to make, potentially take a couple of days.
Okay. So my point in teeing that up is just to encourage all of us to be thinking about what portions of the budget that we think will be relatively easy for us to agree on and move past. So Representative Nordgren, you have your hand up.
Yes, thank you, Mr. Chair. I think you gave us homework last week or the week before. You gave us a list of possible departments that you thought we could just okay without going any more into depth with them. And so Division 3, Kathy Rogers and Mary Jane Waller and I met and came up with their list. So just so you know, when it's time, we're ready to talk to you about that.
Oh, that's outstanding. If you've got that, why don't you consider emailing it to all of us? And then
Okay.
If there's time this afternoon, we'll don't let me quit the adjourn the meeting until we've talked about what you've emailed.
Okay, good. Thank you.
Thank you for that. And then at the end of the day, I see us doing our first reveal of HB1, kind of an intro. Representative Irf and I have spent hours and hours talking back and forth with each other, accessing these rounds, integrating the chairman of the finance committee to make sure that we're in sync. And so I think we have something for Representative Irf to share with the committee that will be the starting point of our conversation with each other about how to invest some excess revenues that fall out from the process he used. And I don't want to shortchange his presentation, but I guess right up front, with everyone in the crowd and everyone on our committee, I want you to just have it clear that what Representative Irf will share with us later is a conversation starting point. it is not the endpoint of the Division 3 work. The endpoint of the Division 3 work will come as we approach the 24th of March, and it'll be done with us talking to one another and agreeing on what we can agree on, and just adding clarity if we disagree on something, so that we know what those issues are. But so don't, when you take a look at it, please don't react to it until after Representative Earth has had a chance to talk about it. And then, so if there are no questions at this point, I think we're ready to start the Public Health Services continuation. Does anyone have any questions on the committee? Okay, not seeing any. Mr. Ripple, why don't you get us going where we're supposed to be in the brief?
Okay, I'll let Karen point you to where you're supposed to be. I think you're at the you're into the budget now, so you're into the actual accounting units. And I think everybody's should be good to go.
Okay. Great. Sorry, I couldn't find the file at first. So where we left off was accounting unit 5608, which is on page 1047, which is tobacco prevention and cessation.
So I got to remember how to read these again. So, okay. So is this one that requires a match? Because we've got like 369,000 to the bed 838. Is there a match in here?
Kelly?
Yes, there is a match, general fund match.
I'm having a hard time hearing. Is that yes or no on a match?
Yes.
Chris, do we know the percentage?
The match is typically 200,000, just a flat match.
So that's more of a MOE. I forget what MOE stands for, but it's kind of the minimal level of effort that we're supposed to do. We put 200,000 in, and that makes us eligible for the rest of it.
That is correct.
So it's a 200K MOE. Okay. Are there any questions from the committee on this area? Representative Rogers?
Yeah, you've mentioned earlier in your narrative about the smoking cessation program that it had worked very well and you'd found good results on it. But I noticed that the funding is down this year. If it's working so well, why are you funding it at a lower rate this year?
Actually, it looks like the general funds are down slightly.
And why is that if it's working so well?
So I don't want to interrupt, but I'm confused. It looks like the general funds are going from 340 to 369. So the general funds are up a little bit. It's the federal funds that are down.
The federal funds were budgeted, sorry for the delay, and hopefully you can hear me. My internet is telling me it's unstable. The federal funds are budgeted at the level that we're being advised to budget by our funders. For fiscal 20 and 21, we had some carry forward funds that we were able to bring. Like 1 year, we didn't spend it all, and we requested to bring the federal funds forward. So the amounts for those 2 years have a little bit of carry forward in them.
You have a follow-up, Representative Rogers? Your hand is still up.
You said you didn't spend it all. Why wasn't it all spent?
I'd have to defer to Dr. Sharala if she might have the answer. Otherwise, we could go back to the program and check with them. A lot of times we can't get contracts set up or stood up timely for whatever the reason may be, or if there's a vacancy in the positions.
I'd like you to get to us why that money wasn't spent. This is the second program that we found that money we authorized wasn't spent. And I'm curious because it is a problem in New Hampshire. It is a deadly problem. and you've shown that the program works. So I'm a little bit leery if we're not using all the money. I'd like to know why. So could you get that information to the division, please?
I can answer that question, Representative Rogers. It's specifically related to our contracting process. There was a delay in the contracting process, and that kind of added the delay in spending down that funds.
And what was the delay?
We actually had an RFP out and the bidding process and getting through the GNC process. So that was the added delay.
So the delay was just what? We didn't have staff enough to do it. We didn't have time. Why was there a delay?
It's the process of getting the bids in and reviewing and getting through some of the back and forth on the financial process, you know, the finalizing the budgets and everything. So that added the delay.
This is Lisa Morris. Good morning, everybody. Maybe Karen would have more information, but I know there that the COVID contracts were taking up quite a bit of time on the contract unit side, and that may have contributed to delays. But Karen, you would know more information on that.
I think that's accurate, Lisa.
So this wouldn't have been done before. I mean, this budget passed before the COVID virus was active. So I'm just curious because we seem to be finding more and more of this, that we authorize things, not just in this department, but we authorize things and they're not done. So that's why I'm curious. Thank you.
Are there other questions here? I know that it's been described that this program is effective, but I don't know how you would measure effectiveness beyond the number of people reached or touched as opposed to the number of people that decided not to smoke. I don't know how you would measure that. So let's go ahead and go to the next area.
Representative
Yeah.
Edwards, if it's okay, I know that Dr. Bella can answer that question if you have the time, but I did want to mention that there was $440,000 over the biennium of 22-23 that was identified as a prioritized need relative to our e-cigarette concerns, the number of adolescents who are utilizing e-cigarettes, electronic cigarettes. So that is not reflected here, but wanted you to know that.
Where would that be reflected, Ms. Morris?
It is not, it is reflected, I believe, in the agency budget. Karen?
Yes, it's a prioritized need in the agency budget.
So which agency, what line item, what number?
No, meaning our agency submission budget that we made on September 15th.
Okay, so you asked the governor to consider it and it didn't make it into his budget.
Correct.
Okay. I had a good weekend. I have to remember how we say these things.
Understood.
Okay. So Representative Wallner, your hand is up.
Yes, thank you. Would that be, would there be federal money for that, or is it 100% general funds?
Well, those dollars that I mentioned were a general fund request.
Okay, thank you.
Okay, so are you able to, with these general funds, decide if you want to focus on prevention of traditional cigarettes or e-cigarettes? Or when you get the general funds, is it segregated and restricting you to only traditional cigarettes?
Dr. Torella.
Can you repeat the question, Representative Edwards? I didn't hear that.
I want to know if you have any restrictions on these general funds to where if we give you general funds, if you must use them on traditional cigarettes, or do you inherently have the flexibility of spending it on e-cigarette prevention efforts?
When we requested, it was specifically for the e-cigarette prevention. The priority request that we made, the 440 that Dr. Morris has mentioned, it's specifically meant for the youth prevention for the e-cigarettes.
Yes, but we do not have restriction on the use of general funds, but we use those general funds for both traditional tobacco and e-cigarettes.
Okay, so you have inherent flexibility in this, even though that there's a 200,000 MOE against the federal money, even that 200,000 is flexible. Is that true?
It's specifically meant for tobacco prevention activities. Yes.
Okay, thank you. Representative Wallner, you have a question there? Okay, your hand is down. I think we can move on.
The next one is account 5659, which is comprehensive cancer.
This is a relatively small amount of general funds and a relatively large amount of federal funds. Is that 170 a required match or an MOE?
It is a required match stated in the notice of award from our funders.
Okay, I'm using the words differently, just so we're tracking on communication. If it's an MOE, I think we have to spend that money before we get the first nickel of federal money. That's distinct from a match in my view. A match in my view has a ratio correlated with it, so that if we give $2, we're eligible for $4. So this 170, is that an MOE or a match or both?
It's called a match in the notice of award, sir.
But it is more similar to what we would define an MOE. Sometimes the federal government likes to call it something different.
Okay, so I'm gonna consider that 170 an MOE. Am I wrong?
That's fine.
Are there any questions here? I don't see any questions.
The next one is 7045, which is Wise Women. This is a grant that started this year. We submitted an item to fiscal committee very recently, so that's why it's not showing anything in adjusted authorized there.
Okay, so this is just federal money. Welcome, Representative Weiler. We're in progress. We've talked about just 2 accounts so far. You haven't missed much discussion on the accounting.
Thank you.
Okay, so this is all federal money. So this is a comment I would make to the committee, and that is earlier when I was talking about the opportunity for us to agree on things that we could remove from future consideration, so that Mr. Ripple and Feldstein can put it to bed and not worry about it. These programs where it's all federal money, I would tend to put into that bucket of we don't need to consider it further for Division 3. And so this would be a good example of that rule of thumb. If it's all federal, let's just accept it and move on. Is there, and I'm taking a little diversion, but is there any discussion to that, or is there any disagreement with that point of view from the committee?
It's the way we've usually dealt.
Okay, Representative Rogers, your hand is up.
Well, I have a problem in the funds for the tobacco prevention and cessation that the governor didn't put in.
Can we pause that conversation and finish this one right now, which is?
I thought you were talking about both of those funds. I'm sorry.
No, I'm only talking about Wise Woman as an example of an account that only has federal money.
Okay, I'm
so
sorry. Sure, we can reserve that then. I just meant, I thought you were talking about all of them.
No, just the ones that only have federal money.
Okay,
Okay, now you still have a comment on tobacco cessation, so we can go back to that if you'd like.
No, I can wait until I thought you wanted us to approve that one now.
Oh, no,
Okay,
no.
never mind then.
Okay, so we were at Wise Woman. I think we can go on unless there are any questions about Wise Woman.
Next accounting unit is 7046, which is arthritis.
Can we just look at the funding line for a quick moment?
All federal funds.
All federal? Are there any questions on this, this activity, arthritis? I'm not seeing any. We can go on.
Okay. The next accounting unit is 7047, which is community collaboration. This is a federal grant, and is this where the prioritized needs are, Lisa? Yes, I'm hearing.
Yes.
I'm seeing Sai nod her head. So there are several prioritized needs with this accounting unit. All what has been referred to in the last legislative session and publicly as parental assistance dollars. They are preventative dollars for families.
Can we go to the funding line just so we have context? So am I reading this right, that this community collaboration is 100% federal funding?
That's correct. The prioritized needs are 100% general funds, though.
What are your prioritized needs? How much?
I believe it was around 1.2 million
Sounds
for
right.
this particular.
So you want 1.2 million for community collaboration and general funds?
Yes, over the biennium, so 600,000 each year.
This was in the list that the governor sent over as well.
That he did what to? You faded just a little bit, and I'm feeling deaf today.
It was in the list that the governor sent over in the letter to the House.
And that you're referring to the letter where he said, hey, it's okay if you spend more money in these areas. That was the gist of this letter?
If that's how you refer to it, it was the letter that the governor sent to the House.
All right. Okay. So are there any other questions? What would you do with 600,000 more a year? How many personnel would you hire, and what would they be doing?
Dr. Chiarella, would you like to take that question?
Sure. We are not hiring people. The funding is going towards 3 of our contracts, specifically focused on collaborations, and all the money is going to the communities. Nothing is staying with us. And the funding is specifically for the 3 agencies that are focused in the community collaborations. And one other funding is also going to Family Connections. It's with the Department of Correction. The funding will be going to them to support specifically for families to provide parental educations the Family Connections one is specifically with the parental education and programs for residents of Hampshire State Prison. The other amount which I talked about, community collaboration, is very much focused on our funding that's coming through federal funds. So those will be going to the 3 communities.
Sai, can you talk about what exactly they'll be doing with those dollars in a
way? I can provide some details. These grants are very much, this funding is very much focused on families with children with 0 to 8. So we are looking at how to create communities and connections for those families to reduce the barrier to access. So connecting them all the resources that the families can access to. So these could be parent education classes, crisis support, warm handouts to childcare or mental health or substance use or dental health, or even economic support for those families. So that's what the focus is on.
So flipping it around, if I'm a head of a household, the impact that these dollars would have is that the people in DHHS and in other community organizations would be better resourced in order to make me aware of the services that are available and help coach me on which services I should apply for.
Yes, and it also help connect you to those services. And the goal is to reduce the rates of child maltreatment. So we're talking about families in need.
And if I can just jump in, if you recall back to last week when we were talking, this is a better connection to some of those home visiting programs I was talking about. And in particular, we had a really successful pilot program for substance exposed infants. So again, getting those families early on, connecting with prenatal providers, making sure from the moment that baby is born that they're connected to the resources they need and the parents have the support they need for appropriate parenting, understanding child development, and in particular with those substance exposed infants of what to expect.
Okay. From when I had children, that seemed like a lot of that sort of communication and coordination would come from the office of the OBGYN that would have follow-up visits with us to check on well baby status. Why is that not adequate these days?
Tricia, do you want to take that?
Sure. So what we're finding is actually that those medical providers are coming and really depending on our family resource centers in particular in our communities to do that sort of dated week-to-week home visiting supportive help that they don't have time for within the context of those well baby visits. Those well baby visits may happen in the early days, once a month. And in these programs, what we find is that we have some evidence-based programs that have home visits that start weekly, and we can connect them to the resources that's needed, provide the modeling and support around appropriate parenting. Again, if you think about those substance exposed infants, those babies come out and they may have some additional needs, making sure they're connected with early supports and services if that's required, if there's an actual developmental issue going on, and really making sure those families are connected to their communities. So the doctors have asked us to work hand in hand with them to make sure that those families are supported, really so that we prevent child maltreatment and the negative health outcomes that we want. Again, if you recall when we were talking about home visiting, many times we start prenatally, and we're even looking at the birth outcomes there, ensuring that folks stick with their tobacco cessation. We know many families have a number of things that they're stressed over, and tobacco is one of them. And we were just talking about the tobacco program, and we know that pregnant women need a lot of support to stay quit, not only during pregnancy, but even postpartum.
And Dr. Torella said that the 600,000, there were no additional personnel that would be funded by that 600,000. Is that accurate? I know she's a physician and not a resource manager. Did she say that?
She's both. She's both. But that is correct. It goes right out to the communities.
Okay. Are there any other questions in this area? I'm not seeing any.
Okay, the next one is 5896, which is the home visiting grant. This is also an area where there is a prioritized need of $464,000 a year, which was also on the list that the governor provided to the House.
Say that number again, 400?
464,000 a year.
Per year. So that's almost $1 million over the biennium.
Yes, 927,000 over the biennium.
We look at, peek ahead at what the breakdown between federal or where
Yes,
is it?
I did. Yep, it's 100% federal as budgeted right now.
Questions about this?
Jess, you sort of go in and out when you're talking. I don't know if that's your close
Okay,
microphone
I'm
or-
trying to, I think my microphone is forward halfway across my desk, so I'll try to lean forward. Are there any other questions from anyone on this? Is that volume okay, Representative Irf?
Yes, that's good. If you can keep maintaining that, yes.
Okay, I don't want to yell at people. All right, so we can continue.
All right, the next one is 5906, which is SUID case registry. This is also a federal grant.
Do you have any prioritized needs in this account?
Nope. I think
Okay.
we've talked about all of the public health prioritized needs at this point, if I remember correctly. There might be one
Okay.
more.
Yeah, I think there's one more in the laboratory.
Oh, under the lab, that's right.
Are there any questions on the, remind me the acronym, SUID?
Sudden unexpected infant death.
Sudden unexpected infant death.
I can't even imagine being a parent and having that happen.
Can I ask a question about that?
Sure.
This isn't budget specific, but I've experienced this. And my understanding is that it was a long time ago, it was back in the 90s, that you no longer provide things like the autopsy report to the parents. Is that true?
I can check on that, but we do talk with the parents. Our Office of Chief Medical Examiner reaches out to them, provides them all the grief resources. That's what we do. But I can check on whether that information about autopsy is limited now or not.
I missed that word when you said you reached out to them to discuss what?
Grief resources, the resources for to support them during their grief time. Like it could be.
Right. No, okay. I understand the grief resources. I'm asking more about the actual cause of death resources as opposed to the, we joined the SIDS group at the time, which I hope is still active. And it was a big help, no doubt about it. But I'm curious also about the cause of death reports.
We can follow up on that one. Most of that information goes from our Office of Chief Medical Examiner office, and I can check on that.
Thank you.
Representative Irf, we're so sorry for your loss.
Well, thank you. I appreciate that. I really wasn't trying to draw sympathy.
Okay.
All right, so I think we're on 6048 WIC infrastructure.
That's correct.
And then what are the general funds requests there?
There are not any.
Are there any questions here by the committee? Seeing none, let's go to the next.
Okay, the next one is 1227, which is combined chronic disease. This is 100% federal.
Are there any questions on this one?
Yes, just a quick one, Karen. Sorry. I noticed some of these accounts, Karen, that are just 100% federal still have a general line, whereas others don't. Is that because at points in time they've had general funding?
That's possible.
Okay.
Yes, that would be my guess, that either in 20 or 21, there was some general funds there, sometimes inappropriately. Or incorrectly, I should say, maybe, you know. Okay, the next one is 1228, which is the Poison Control Center.
This one is entirely or pretty, it's all general funds, or there's some transfer from other agencies, but no federal money.
Correct.
Okay, and then this is, it's flat funded from the prior year. Is that intentional? What's going on in this area? Are we serving the same number of people, or the call volumes going up? Or how are things going here?
Go ahead.
Okay.
Go ahead.
Yes, the call volumes have been going up during the COVID time. Specifically, there was a 24% increase from 2019, and largely due to pandemic about cleaning and all other questions. In 2020, we had around close to 9,300 human exposures, so different kind of substances. So that's what they have done. and a lot of prevention resources during pandemic time. So related to poisonings, as well as fact sheets about what's the right way of cleaning and all other things. Yes, there has been increase, but we have been flat funding them.
Representative Nordgren, question?
Yes, thank you. Do we still service Maine with our poison control center? I believe we used to.
It's a Northern New England Poison Center, but it is, yes, it's based in Maine, but it serves New Hampshire specifically.
Okay, thank you.
Thank you for pointing that out, Representative Nordgren. All right, I don't see any other questions. I think we can go to the next.
The next one is 1869, which is, oh, do you want to explain what that is, Sai? That is too many acronyms for me.
That's fine, I can tell. It's called National Violent Death Registry.
Thank you.
It's all federal.
Yes.
Okay, are there any questions here? We can move on. How are we doing, Ms. Rounds? We got an hour or so or longer? What do you think to get through public health?
It's probably about another hour. We were a little bit slow starting off, but I think we're moving along now, so.
All right.
3386, early hearing detection and intervention.
Very good.
I knew detention didn't make sense there, so.
Okay, this is all federal funds.
It is.
I'm surprised that's enough money, but who are we testing with that? Are we testing only children who show special characteristics, or are we doing 100% well baby? Who's the target population?
It's universal screening. So we do screen for all the kids, all the babies born in New Hampshire. And then based on their need, then we follow up on their, if they have some hearing deficiency, then we follow up on their families and connect them as well as to the providers and others.
I would assume the follow-up is coming from a different budget though.
Yes, yes.
There are 2 newborn hearing screening budgets.
Going on to the next page, it's 3387 newborn hearing.
Well, how many babies get tested in that federal program per year? I heard you say all of them, but what is that in New Hampshire?
We have around 12,000 births happening in New Hampshire. So basically we are looking at around 12,000 babies for screening. Yeah. And then follow-up is around, because the follow-up we do up to age of 3 years. So it's around 400 kids that we follow up.
Very good. Let's talk about 3387, unless I don't see any questions.
Is this also 100% federal?
Okay. Do we have any sense of how long the federal government will want to continue funding these 2 lines? Is this something that we get an early indicator on whether or not they think this should be transitioned to the state at some point?
We haven't gotten anything from them yet. I haven't seen them changing any of their thought process on how this is funded at this point of time or how it should be funded in future.
Go to the next one.
Okay. The next one is 3388, rape prevention and education.
So we're dropping, the federal government looks like they went up, they spiked in 21, but from 20, and that they're returning to their previous levels. Why did they spike for a year? Do we know?
Sometimes they have extra funding, so they provide us saying like this is an extra dollars or funding that's available for the states. So that's how what happened in the 2021 timeline, and now we are back to our regular funding stream.
Are there any questions on this line item? I'm not seeing any, so we can go on.
3396 is EWIC implementation, which is no longer in use. So then moving down to 3397 is the cancer registry.
Okay, I'm sorry, you jumped right when I was, okay. So we've got on the cancer registry, in 20, we had 0 general funds, and we put 150 in 21, and we're increasing that a little bit. What's the story here? Why did we get into this with general funds when federal funds appear to be going up?
Go ahead, Dr. Chiarella.
I'm not sure why it is not reflecting, but we always had general funds in the cancer registry because it's required under the MOA has a state match. And not sure why we are seeing some.
The fiscal year 20 may have closed incorrectly, or it could be that the general funds ended up being matched by cost allocation, but Shelley?
I would have to double check that, Karen, yes.
Okay.
So when you're double checking this, would you give us the exact match percentage requirement?
Absolutely.
I'm assuming that,
We might want to call it an MOE, Chairman.
okay, good. If it's an MOE, I want to know versus a match.
Okay, you got it.
Thank you for accepting my simple terminology. All right, we can continue.
All right, 5040 is opioid surveillance. And this is 100% federal.
What are they doing? They dropped theirs a lot. There's a lot of drop in the federal funds. So are we seeing a decrease in the federal well, that's hard to say because they started at 324 in FY20 and then multiplied that by 10 times or more, and we're still at their higher level.
I think, and Shelley, correct me if I'm wrong, but I think there was unspent grant in fiscal year 20 that may be being reflected in 21.
Definitely, we got our first year award was smaller. We got a bigger award in the middle of 20. We did go to fiscal committee and get it budgeted, but we were working on standing up the programs and the contracts, so it didn't get expended all in 20. So 21 is at the level that moving forward, what our award is. Or, yeah.
Representative Wallner, do you have a question, ma'am? You're on mute.
Sorry about that. I see that the contracts are about $500,000 less each year than they were in 21. What kinds of contracts are we not going to be having in 22 and 23?
I can answer that question. It's not going to impact any of our current contracts. They will be all level funded. As you can see, the 2021 is the time when we had some extra dollars, extra funding that actually went into the contracts, but everyone is funded and no changes on their contract lines.
Great, thank you.
I'm not seeing any more questions. We can go to 7048, I think is next.
Yes, which is pediatric mental health access. And this is 100% federal.
Are there any questions here? I'm not seeing any. We can go.
Okay. The next one is 1079, which is pediatric cancer survey, which was a one-time expenditure in fiscal year 21. Then right after that is 3487, which is maternal mortality, which is 100% federal.
Questions on maternal mortality? This is the death of the mother in childbirth. Is that what that is generally?
Up to 1 year of after pregnancy or after delivery.
How many of those do we have a year?
We are very lucky in our state. Our numbers are very low. They are less than, they're very low compared to the rest of the country.
Like
So,
less than 10?
Yes,
I mean,
less
if we're
than
having
10.
12,000 kids, are we losing less than 10 moms, you think?
yes, less than 10 actually, it's less than 10, yes.
The next one is chronic disease asthma, which is also 100% federal.
Any questions here? I'm not seeing any.
Okay, the next one is 7423, which is senior nutrition programs, 100% federal.
So we're shifting, we plan to shift a lot of the money to grants for public assistance and relief and away from contracts for program services. So is this an accounting cleanup or a program change?
Yes, this is the change that I've talked about where we are moving it to better track subrecipient contracts for our single audit.
Thank you for doing that. What's next?
So I would just mention that that is the last accounting unit in this bureau. So thank you, Dr. Shirella, for being here and for your help. And Lisa, who's the next bureau chief that should come over for infectious disease?
So that would be
Thank you,
Beth
Dr.
Daly.
Chirella.
Thank you, Dr. Chirella. We have Dr. Daly, Beth Daly.
Great. Okay. So the first one in this bureau is 2222, which is the Ryan White Part B. This is 100% federal funds.
Is this for HIV? It is.
Yes.
So how are we doing with HIV stats? Have they trended down, or are we still experiencing HIV in worrisome levels?
Dr. Daly is on the Zoom and she can answer that question for you.
Great. Yes. Good morning, everyone. Thank you, Mr. Chairman, for that question. So HIV, we do continue to identify new infections each year. It's actually become pretty stable and plateaued here in New Hampshire. We have between 25 and 50 new cases identified each year in New Hampshire. And in terms of people living with HIV and AIDS, it's about 1,200 to 1,300 people in New Hampshire. And those are the people that we're serving through the different contracts that we have in place.
So let's say it's between, you just said it. You just said we have about 15 to 25 a year. What's the primary disease vector? Is it still unprotected sex? Is it generational, pass from mom to baby, or what's the disease vector?
Great question. So primarily who we are seeing become infected with HIV currently are men who have sex with men. So it's sexual transmission. And then we also do have some transmission occurring through shared needles for drug use. And it's very uncommon actually to have the mom pass to the baby, although we do have, one case happen every few years where we've documented that occurring. And that's because we try to get as many people who get diagnosed with HIV on effective treatment. So that kind of thing does not happen. As long as that mom's on her antiviral therapy, then it's unlikely the baby will become infected.
Well, that's good news. So in this Ryan fund, is this, I should be able to look at it faster than I am, but is this, it says care assistance. So of the, is this meant to go to the 15 to 25 to augment their health care to deal specifically with their HIV problems?
Yes, so it actually serves about 1,200 to 1,300 people who are living with HIV and AIDS in New Hampshire. So that 25 to 50 are the number of new infections that we add each year. But it's obviously a lifelong chronic condition now. And so people will live with it for their lifetime and will need to continue to receive that effective care to keep them alive. And so there's a number of different accounting units here that are for different HIV services. And this one does provide financial assistance to people who need it to provide that care for them.
Financial assistance in what type? Are we helping them pay medical bills, prescriptions? Are we helping them with housing or something else? What kind of assistance are we giving?
Sure. So we're a payer of last resort. So what we first try to do is connect people to health insurance that they may already be eligible for. We'll connect them to Medicaid, and we might help them pay their premiums or copays if they can't afford that. And then we will pay for their medical bills as well, anything that's outstanding, or if they're completely uninsured. But again, we try to connect them to Medicaid first. And so it provides that funding for their treatment. And also some wraparound services. We have case managers who assist these people with getting access to different services in the state. It might include, for example, transportation to their medical appointments. There is housing money available for people living with HIV and AIDS, but that's in a different accounting unit and overseen by the Bureau of Housing, Homelessness and Housing at DHHS.
Okay. So have we gotten a number of HIV transmissions that are associated with unprotected sex? Have we gotten that number down low enough to where people know they shouldn't be having unprotected sex, they just are doing it anyways? Or have we kind of maxed out the potential of prevention?
Well, I'd hate to say that we've maxed out the potential of prevention, but we have plateaued, right? So we continue to still see transmission occurring. I think a lot of people obviously know about HIV and the risks from risky behavior. However, there's different barriers that come into play that prevent people from being able to make good choices all the time. And so there's new technologies available, new medications that have come on the market where people can actually take a medicine every day if they want to prevent getting HIV if they are in a risky group. So there's new options for us to try and prevent HIV, but I'd like to think that we could not have any HIV too, but certainly it has plateaued. And
Yeah, 0 is the goal. But,
yeah.
All right. Are there any questions other than mine in this area? Representative Nordgren?
Thank you, Mr. Chair. I was just wanting to maybe suggest, obviously it's your decision, Mr. Chair, that we okay all these departments where we've just had federal funding. I think we'd have a great feeling of accomplishment. And it would make our list longer that we have to go back and look at.
So I agree with what your intent is there. The process I was anticipating was just slightly different. I was asking, I just this morning asked Mr. Ripple to create a list of all of the accounts that are federal funds only, so that once we got a documented list in front of us, we could review it overnight just to make sure we're comfortable with it, and that we would do one vote on all of those. But I thought we may want to see a list to help document exactly what we're voting on.
That sounds like a good plan. Thank you very much.
Thank you. All right, so I think we're ready for 22, 23.
Correct, which is Boston EMA Part A. Which is also related to HIV and is private local funds. Shelley, where do
Is it-
these funds come from?
Good question. What is a private local fund?
Dr. Daly, would you like to address this?
Sure, these are coming from the City of Boston Public Health. They've received funding for their EMA, their metropolitan area. And because New Hampshire abuts that region, part of our New Hampshire counties are in their EMA. And they provide us funding to help serve the community that is part of their larger region, the Boston region. And so we are able to use these funds to serve people who are in Hillsborough, Rockingham, and Stratford counties.
So that's all great. I just wonder, as fastidious as Ms. Rounds is, if this is properly labeled, it sounds like the Boston EMA may be getting federal money and then sharing it with us. And that would make that government funds, not private. Or did I misunderstand?
So that it would be federal to the City of Boston, and then it's private local funds to us. So it's the City of Boston's responsibility to audit us as their subrecipient for these funds. The federal government would audit the City of Boston.
So we're considering the City of Boston a government entity, a private source of local funds.
Correct.
Okay, I don't see any other questions. We could do 229.
Okay, which is pharmaceutical rebates.
All federal, right? No, agency
A
income.
little bit of agency income, and the general funds that are there in fiscal year 20 should not have been.
So the way I'm reading that, that's a huge amount, $5 million on agency income and very little federal.
Oh, yes, I'm sorry, I read it backwards.
No, I said it wrong to begin with. I think I started it wrong. So as I understand this money, well, you tell me what this money is. Where are these rebates coming from? I think they come from the pharmaceutical companies, but on what basis?
They do. So recall that we pay for people's HIV medications. And normally, you know, patients might get rebates back for purchasing those drugs, but because we're the ones who are actually paying for it, we get those rebates back paid to us. It's obviously a substantial amount of money that pays for the majority of our HIV program. So where we do get some federal funding that you've seen through the different accounting units, we're required actually first to use our drug rebate money before we tap into the federal funding. And so this funds a substantial portion of our program, a number of different positions and a lot of our contracts. It's basically like reinvesting back into the program.
So thank you for that. So I'm looking at expense item 530, drug rebates. And that's an expense item that looks like it wants to be an income line. And what is that 530 paying for?
Shelley, could you help me out with this class?
Yes, so in this class is where the payments are made to our contracted vendor for the actual prescriptions, as well as the other services that Dr. Daly spoke of, that when we're required to pay the rebates first, we pay the for the enrollees. I know that's not the right word, I'm sorry, for their services out of this line as well before we are able to move over to the federal funds that we get in accounting unit 2222.
So basically that class is used to purchase additional pharmaceuticals.
I'm going to come off of that area, but it sounds like there's a lot of cash moving out from private hands back to private hands. So I'll come to you, Representative Weiler, in just a second, sir. I'm just hoping that this is got great internal controls and great auditing around it, because it just feels like it's a cash-rich business. But Representative Weiler, do you have a comment, question, sir?
Yes, I recall in the past, some of the budgets, we have used as much as $20 million in rebates for balancing the budget. Are we still getting considerable rebates from the companies?
So I think you're thinking about Medicaid drug rebates. And we do still get substantial drug rebates there, and those are budgeted in the Medicaid budget. These drug rebates are specific to the HIV drugs that we purchase.
So those get budgeted somewhere else?
Yes.
Okay, thank you.
You're welcome.
Okay, are there any other questions? Because if there aren't, I think we can go to 5170, disease control.
Yes. Which is mostly on page 1072.
So we're back to using general funds here.
Yes. Shelley, is there a match or an MOE?
There are no match or MOE in this AU.
So the federal money is just gratis for this program, and then we believe that we need to augment it with general funds. Is that a proper way of saying it?
So the general funds that are in this account are to support disease control emergencies. There's, I think, $100,000 that's there in case we have some type of emergency or outbreak that we need to respond to, and we have funds available to be able to mount that response, because a lot of our federal funding is really used for programmatic work. And so those funds are available. Sometimes we don't use them. We obviously won't use them if we don't need them. We've happened to have a number of different emergencies over the last few years that we've used. For example, during our hepatitis A outbreak, we've also used those funds during our PFAS response to help pay for testing for the individuals who were impacted by the water contamination. And then we also have funds in here available to support tuberculosis treatment for people who require financial assistance if they have tuberculosis, which is highly communicable, and we obviously need people to get treated for it. And so again, like our HIV financial assistance, we will also help to pay for people's tuberculosis medications until they're cured, so that they're not transmitting their infection.
I thought we were on the cusp of eradicating TB.
Yes.
Come back?
We've been working on tuberculosis control for a lot, actually centuries, right? But no, it does still exist. We primarily see it in people who have international travel or who have lived internationally, but there are, hundreds of people each year in New Hampshire who have been exposed and have a skin test showing that they have been exposed at some point in their lifetime, and we want them to get treated to prevent actually becoming ill with active TB, where they can cough and make people sick. But we have about 20 cases of active TB.
At what point do our newly arrived refugees get tested for TB? Do they get tested for TB while they're in their home country, or do we wait until they get to New Hampshire?
They do get tested before they arrive, in the case of like refugees, right? And then they also get tested when they arrive in New Hampshire too.
All right. Are there any other questions in this area? I'm not seeing any. You can go.
Okay. The next one is 5174, which is the Mosquito Control Fund.
You guys need to spend more of that in my yard. That's not very much money. What are you really doing with $40,000 for a state this big?
So the way that we're using these funds is to purchase reagents, laboratory testing reagents for our public health lab, to be able to do all the testing it does for both mosquitoes and humans. We do get a very small amount of funding from the federal government, but it's just, I think it's less than $10,000 or $10,000. It's really only enough to test humans. And what we need to do is test those mosquitoes, so we have early indicators and warnings of when we are finding the different viruses, Triple E and West Nile virus, out in the community, so we can alert the public.
That's the lab costs so we know what kind of mosquito diseases are.
Correct. This account used to be bigger and it included some reimbursement to communities to be able to spray, like you were just mentioning. But over time, that has been reduced through the budgeting process to save the general funds.
Thank you.
Okay. Moving down, the next one is 5177 vaccine insurers. And this is one of those accounting units that closed incorrectly. There should not have been general funds in fiscal year 20 there.
Right. Thank you. So are we on 5178 then?
Sure, that's the immunization program.
I'm sorry. Yeah, because there are no funds in the governor's budget for this, right? Except for the
general
revolving.
funds. I'm sorry, wait.
5177 vaccines insurers, there's a revolving fund, but there are no general funds going in to replenish it.
Correct. Correct. It's just the money that the 16 million that comes from, I don't remember where, but yes.
From the insurers who pay into a purchasing pool so that we can purchase vaccines at reduced cost off the CDC contract, and we purchase all vaccines for children in the state.
So, okay, I'm just going to throw a comment that a constituent made at me about 6 months ago. She believed that we had a profit motive as a state to over-vaccinate children, because every time we vaccinated a child, we would get money from the pharmaceutical companies. And as she described it, she was convinced that there's a profit motive here that is potentially causing bad state behavior with causing us to want to over-vaccinate. How would you respond to that constituent?
Well, I would say that is not true. There's no profit or funding that's provided based on how many kids we're vaccinating. There's no kickbacks from pharmaceutical companies, and our only interest in vaccinating children is to prevent deadly diseases or disability among kids.
Okay, but if you boil down what she said to me, the part that still seems to have some truth into it is that the vaccine companies, the suppliers, are giving us some amount of money based on the total number of kids we have vaccinated. Is that true or false?
That is false. These funds are coming from the insurance companies who are paying into a purchasing pool so that they can reduce their costs associated with paying for vaccination for kids. It's not coming from pharmaceutical companies. We don't get any money from pharmaceutical companies relative to vaccines.
And we cannot use these funds for any purpose other than that.
Purchasing
restricted
vaccines.
funds.
Yeah.
Correct.
Representative Verf, you have a question, sir?
Yes, sir. Thank you, Mr. Chairman. So are they paying in voluntarily because it's less expensive for them to pay to the state, and then the state can get a better price on the vaccines rather than them having to buy them individually for each child?
Yes, so there's a state law that is on the books that creates the New Hampshire Vaccine Association, where the insurers come together and pay in. They're assessed a fee based on their accessible lives, and there's a whole feeing process that happens where they're paying into it so that we can purchase these vaccines. I don't believe that it's their participation is necessarily mandatory, though. I'd have to go back and look at that, but the insurers like this program and they participate in it because it saves about $10 million each year in vaccine costs, just for the vaccine alone.
That's what I was wondering. And so is the savings because you can buy it in bulk as opposed to them?
We can purchase it off of the federal CDC contract, which offers substantial savings.
Which they cannot do.
Correct.
Thank you.
Representative Weiler?
I think it's also true that some people's health insurance plans pay for this, for them to go and have these shots, but this way the shot would be less expensive to the insurance company paying for it than if they didn't get into this pool.
Correct.
So, Ms. Rounds,
Yes, sir.
as I look at where we are in the document, I see an elevator bar that looks like it's about 60% of the way down. Are we finished when we get all the way to the bottom, or are we finished somewhere in between here and the bottom?
No, we're finished way before that. I have a lot of extra pages in this PDF of things that are at the end of the budget. Plus public health is probably like starts somewhere shortly after the middle of our budget. So we're done at page 1097. We're currently on page 1074. So we only have about another 20 pages.
Super, thank you. 5178, immunization program.
Yes.
We're bumping up the general fund contribution to the immunization program a lot. Is what is driving the increase in immunization effort? I mean, obviously COVID, but but I'm assuming that's covered by federal money to pay for COVID immunizations.
Shelley, could you speak specifically to the general funds? Is this due to the loss of federal funds through Medicaid?
I can't answer that question, Dr. Daly. I'm not aware of loss of Medicaid funds.
Okay. I thought it might be related to how we were purchasing vaccine. Okay. So I know what the federal funds are for, and there's a echo. I'm sorry. I don't know if you're all hearing that too. Maybe you want to mute them, Shelley. The federal fund, the general funds, I'm sorry, it's primarily federally funded. The general funds that are in there fund both our maintenance on our immunization ordering system and vaccine registry. And it also funds a small amount of purchasing vaccines as a contribution to the payer program that I had just mentioned. There's an expectation that the state contributes some amount of funds to help purchase vaccines as a state insurer.
What I'd like to do, Dr. Daly, is suspend talking about this a little bit and maybe come back to it and give you guys a chance to really plow into it and make sure you know what we're doing here, because I'm looking at the federal funds going up substantially from 2020. And then I'm looking at the general fund going up way more than substantially from 2020. And so this program is growing rapidly, both with federal and general funds. And I would just like to know what is driving that growth rate and what's next. Is this trend going to continue into the next budget, or are we dealing with something transitional? So
we can get you that follow-up information.
Okay, so maybe we could just arrange a phone call or something.
I think we can provide it all in writing. It looks like it's primarily due to a new temporary full-time position and an increase in line 103. So we'll get you what that actually is and what it's for.
All right, so you'll follow up with us. Thank you so much. Can we go to the next?
Sure, the next one is 5179, hospital-acquired infections. And there are no general funds in this accounting unit.
Big jump in federal funds.
Yes, so what happens with this account, it funds our hospital acquired infections program. We're required to try to secure federal funds before we fee the healthcare facilities to pay for this program. And that's what the other funds are here. The agency income funds is a fee system. And so over time, there's been quite a bit of fluctuation in terms of what CDC is funding. It started off when this program first started that it was primarily federally funded, and then CDC decreased their funding and they unfunded a few of our positions that we then had to pay for through fees. And now they have instilled more funding into the program, and we've been able to pay for the positions again through federal funds.
Thank you. Great explanation. What's next?
5084 is Ebola. That account has been closed out. 7536 is STD HIV prevention.
Okay, so to what extent does this program overlap with the family planning dollars that has a small piece of it dedicated to STD prevention?
So, and I don't know if Cy or Trish want to chime in on how this overlaps with family planning, but our funds are really targeted specifically to STDs. They're identifying them through testing and then investigating the individual cases. We do some prevention work, but it's primarily around the control of once we identify those infections and then we investigate them. We do work in partnership with the family planning program to make sure that we're not duplicating efforts and that it's very coordinated.
So even though the word says prevention, it sounds like most of the money you're spending is really on treatment.
Yes, and identifying, testing, identification, and then investigating those cases and trying to do disease control work around them.
Drop in general funds here, is that intentional or is there a prioritized need that's not being met?
So the drop, yep. I'm sorry, I heard someone else coming forward. The drop in general funds, I believe, is we had a prioritized need that we had in the last budget cycle that was funded, and then it's being unfunded in this budget. Is that right, Shelley?
Yes, we didn't put it forward for the 22-23 biennium.
I do have a question about STDs still. Does the department maintain a dashboard so that everyone can see what kind of STDs are in New Hampshire and what the trends are for increase or decrease? Is there a place that people can go for them to get visibility into the STD situation?
Yes, we do have static data reports, not necessarily an interactive dashboard, that are available on our website. We produce a monthly report as well as a more comprehensive 5-year report on STDs and HIV. And those are available on our website. We can send you the link afterwards.
No, I'm more concerned that information is accessible to high school nurses and it's getting out into the high school population so that kids are being warned that this stuff is real. And being in that age group, I think they need to hear that a lot. So I'm just curious the extent to which we are actively broadcasting to the audience of high school students. Is it getting, or is this message getting through? I don't want to scare kids. I just want to have them know what's going on.
I do think that they cover these topics in health education programs in schools. Honestly, we see STDs across the lifespan. We do have the highest numbers of chlamydia, for example, in 15 to 24-year-olds, but there's a great deal of education that is happening, and it really comes down to personal behavior choices.
And I would just add that our family planning programs, this is where that really comes in, where individuals are receiving care. They're getting tremendous amount of education at that point around how to reduce their risk. We also have a pretty robust social media work right now, again, sort of aiming at that younger and as well as an older population about risks around sexually transmitted diseases. We also have some other work in Dr. Chirala's group around a program called the Pregnancy Prevention Program or the PrEP program. And within that is a significant amount of education, again, focused at a younger population for STI prevention.
Good. I just remember hearing it once in gym class and never hearing it again in high school. And so You know, this is kind of more of the constant drumbeat. Seems like it may be effective, but
Times
all
have
right.
changed, Representative Edwards.
Pardon me?
Times have changed.
I think somebody else has mentioned that to me a couple of times. My kids, for example. Okay, so I think, are there any other questions on 7536? All right.
5022 is Zika preparedness. That grant has ended. Moving down to 5093, adult immunization, PPHF also has ended. The same thing with 5094, syndrome surveillance. So moving down to public health crisis response, 7039, which is 100% federal funds.
You're on a roll. Keep going.
Okay. So first I would just say thank you, Dr. Daly, for joining us. I know how busy you are, and I appreciate you taking the time to hang out with finance today.
Thank you.
Thank you,
Yeah,
Dr. Daly.
Yeah, thank you so much. I really appreciated your answers.
And then Lisa, is Chris Bean?
Yes, Dr. Bean is on. If you would allow her in, Kevin, that would be great.
Just bring her in now.
Thanks, Kevin. Just give her a second so that she hears any questions. All right, great. So the first one is 1835, which is New Hampshire DLC. Somebody help me.
It's epidemiology laboratory capacity.
Thank you. And that is a 100% federal grant.
Any questions? All right.
Okay, the next one is 1878, which is the lab equipment fund. This is also, this is actually a revolving fund. Shelley, what's the source of funds in this revolving fund?
Fees that come into the lab.
Oh, that's right.
So I recalled somewhere in our briefings that we had some significantly aging lab equipment and we needed a lot of replacement. Is that this area? Is this activity?
It is an accounting unit a little further down that we have a prioritized need.
Correct. Thank you for remembering, Representative Edwards.
I can't treat patients, but I can buy equipment. I know how to do that. So.
Okay, the next accounting unit is 3063, the Association of Public Health Labs. That's 100% other funds. No general funds here.
Now, are these paid by pathologists or in places that employ pathologists? Who's paying for these?
This is the Association of Public Health Labs who provides some project-based funding for us. So it's an association we have membership of, as do all the state public health laboratories.
Okay, so who is a member of that, for example?
I can add to it if you'd like me to.
Yes, of
Our public health laboratory is a member of the Association of Public Health Laboratories. So we pay an annual dues as a state member. The state of New Hampshire is a member. And there are oftentimes funds available for special projects for us to implement new types of testing that they are able to support us to do.
Okay, I'm just looking at the 174,000, and as small as New Hampshire is, I'm just wondering if these dues are really onerous to the members. But
These, I don't
That's not our dues, no.
Yeah, these aren't dues. These are money. This is money they sent to us for projects.
Oh, okay. So like if you go to the next page, so the private local funds, these are not dues.
Correct.
No, these are funds that we could have access to implement projects. It could be a training for laboratory. Our dues we currently
ma'am.
pay.
This is a revenue source. I'm sorry.
Correct. Yes, it's a revenue source. That's correct.
Somebody's paying it. I was just trying to get my arms around who is paying it.
The association is. So the association that we are part of, that we pay dues to be part of, then gives us money back to run projects.
Okay, great. Are there any other questions here? All right. Are we at 5126?
Yes, which is the Ebola ELC, which ended in 21. So moving right down to 7966, which is the public health laboratory, which is also where the prioritized need is. The prioritized need is for 50,000 in general funds for 22 and 100,000 for general funds in 23, all of which would be for lab equipment.
Is it because there are new things we can test for, or are we replacing old equipment to test for the same stuff?
Dr. Beanie, do you want to answer that?
Sure. I would say that it's for both of those things. So we need to maintain the infrastructure and replace aging equipment and instruments. One example of that we had this year was the deionized water systems in our laboratory, or DI water, that we need to maintain that infrastructure in order to keep the lab operations uninterrupted. So in addition to that, we do need to purchase new instrumentation and modernize the laboratory as new methods become available. Much of that funding in many cases is available through federal funds, but not all of it. So it's for both aging instruments and modernization, both.
Okay, so I see general funds of 3.836 million. You would like that to be 3.9 million? Is that what your prioritized need would do? Am I hearing you right?
That's
an
correct.
addition. It's an additional $150,000 over the biennium.
Like it was 50 in the first year, 100 in the second.
That's correct.
Correct.
Laboratory repairs, new instrumentation is very, very expensive. Different than other kinds of equipment.
Worked in the radiology world, but I kept an eye on what was going on in pathology. It is expensive stuff.
Yeah, it surely is.
All right, well, great. Are there questions here from the committee? We're back into general funds here, and it's not an insignificant amount. Representative.
Go ahead.
I see the $800,000 roughly, a little less, I guess. General fund increase. I think I'm reading that right, but I'm just having a hard time picking up where that is up above. I see there's a slight decrease in some of the agency income, and a pretty big decrease. Oh, it's in the general funds decrease. No, that's general funds. Is that what you're doing? You make up on the general fund? The federal fund. Sorry, said that backwards.
There is a decrease there in the federal funds, and this is an all cost allocated federal funds. There's no direct federal grant to this area. So these are allocated federal funds from other areas in public health for work that the lab is doing. And the allocation changed on the positions based on the work that they're doing.
That's one of those things that's controlled by the higher ups, people higher than you.
Yes.
Or at least off
Yes.
the side.
It's the thing that's controlled by our cost allocation plan, and yes.
Thank you.
So Ms. Rounds, for the 150K over the biennium,
Yes.
would you just email us the list of what would be purchased and where it would physically go to be located. I wouldn't be surprised if it was just like 2 or 3 items is all, but so a very short list.
Or
Yes.
one.
One.
Or one with installment payments, is that what you're saying?
Yeah, right.
Yes, we will get you that information.
Thank you. And I assume that list represents what you would forego buying if we didn't plus up this account.
Correct.
Yes,
Okay, very good. Can we move on?
sure. So the next one is the 8276 Food Emergency Response Network. This is 100% federal.
Any questions? Not seeing any, we can go on.
Okay, and then the last one in this area is 8280, which is the Biomonitoring Grant, which is also 100% federal.
All right. Thank you.
All right, thank you, Dr. Bean.
Thank you.
Thanks,
Thank you,
Dr.
Dr.
Bean.
Bean.
You're not related to Harry Bean, are you? Representative Harry Bean?
No, I'm not.
Just talking to him, he's related to like half the people in New Hampshire, so.
Oh, thank you very much.
Thank you.
All right, the next one is 1111, Homeland Security. And Lisa, did you want to bring over Ian? I know that he is fairly new, but.
We're gonna, Tricia is available to answer some of these questions, as am I.
Okay, great. So I believe that, yeah, this transfer comes from Homeland Security. So it comes from the Department of Safety on 1111.
It's not a lot of money.
No.
Yeah. The next one is 1112, which is Homeland Security. Well,
This is radiological emergency prevention
thank you.
or program, radiological emergency program.
Okay, so this one, we've got some general funds and we got 3 times the general funds as we do federal funds. Am I reading that right?
There is also agency income there as well. But yeah.
Where's the agency income coming from?
Right. I would.
Tricia, can you answer some of these questions? Is this through the ESU?
You know what, we're gonna have, I don't know that the ESU doesn't receive that income, I believe. So we'll have to get back to you on that for radiological work.
So as I remember from the briefing, we did radiological surveys routinely around the nuclear plant and basically the fallout zone of an air drift, that region. And if that's all we're doing, it just looks like a lot of money to do just that. So
I believe these are, there is the rep program in protection, and we just have to understand what this particular AU is, and I apologize for not having that information, but we will get that for you.
Okay, all right, that's fair.
Yeah, it's just dividing out between what's in protection and what's in this unit. And as you know, these are brand new funds to DPHS, so we're still getting our hands wrapped around them.
Okay, so if we're monitoring Seabrook, somebody had to have that program before DHHS had it then. So it got transferred from somebody.
It got transferred from the Office of the Commissioner, and I should have asked my finance person for the Office of the Commissioner to be on today, and I didn't think to. So I'm sorry, that we'll just have to follow up.
No problem. Okay, so we can go to 1113, I think.
Yes, which is hospital preparedness. And this is 100% federal.
What's the next one after 1113?
The next
14.
one is 1114, which is public health emergency preparedness, which does have some general funds in it, but is mostly federal, 5 million federal. Sorry.
So you have 24 people in public health emergency preparedness. We're moving to 23.
Wondering if one of them moved.
Yeah.
They must have. I'm just not seeing.
So if I can jump in, and probably Shelley can provide some greater clarity on this. The FEP program has been historically based within our infectious disease program. It is moving over into the emergency services to our new Bureau of Public Health Preparedness. With that, it's a pretty robust federal funding source, and it has funded a number of positions throughout both the division and historically when the ESU was in the commissioner's office. So they're spread around. We are doing some, consolidating right now of trying to get all the positions in the right place.
Okay. So is there a match or an MOE here? And if it's a match, go ahead.
I'm sorry, I didn't mean to interrupt you. The notice of award states that we have to match 10% of our award. So it's
And
not
is-
always the same dollar amount, sir.
So is there a maximum though? Have they said we could do 10% up to a certain level?
No, there's no maximum.
If there are additional questions, Dr. Daly is still on the call. This particular AU has been in her bureau up until recently.
Well, if we only have a 10% match here, this is really, as to use Ms. Tilley's remark, this is really a rich source of federal funding. And I'm just curious, did you have any prioritized needs here? Do you feel like this program is adequate? 24 people to me sounds like a lot of people, but I'm not sure what they're doing on a day-to-day basis.
I'm going to have Dr. Daly talk about this AU.
Yeah, thank you. So historically, we have used this funding to increase our preparedness, and there's about 15 different capabilities that we need to address. It includes things like making sure that we can carry out mass vaccination, making sure that we have laboratory testing in place, epidemiology, people who are investigating different potential public health threats. And so we've actually used the funding to fund very core infrastructure for public health. We use about 8 positions. 7 or 8 positions are funded in the Bureau of Infectious Disease Control. These are nurse investigators, epidemiologists, people looking at data systems to try and identify any potential public health threats. We also fund about the same number of positions in our laboratory. These are people who are testing, for example, white powder that you might find on an envelope. Those types of events still happen following 9/11. We also fund a number of positions in our new bureau, which was previously the Emergency Services Unit. These are people who are writing plans, working with our partners to ensure our preparedness statewide.
So they're doing more than preparing. They're actually doing things like lab work and going out into the communities and checking on things.
We are doing response work in addition to the preparedness work, but they have those obligations when not responding to making sure our plans are in place, keeping those up to date and making that networking with our partners, which has been so critical even for COVID-19. A lot of these staff currently are engaged in COVID-19 work.
Yeah, so that makes sense. But if you have 24 authorized, what is your vacancy on that? Do you know? That's a trivia question.
Actually, currently, I don't believe we have any vacancies at all among those, you know, obviously, like any program, you will have periodic vacancies, but I think we're fully staffed right now.
It sounds like you have clinicians in there, people who could be clinicians that are doing staff work.
Well, we have some public health nursing staff, and they do our investigations, talking to healthcare providers and patients about their different infectious diseases. They do outbreak response. We have, you know, 100 outbreaks a year in New Hampshire. And so they're doing work that's appropriate to their clinical training.
So public health nurses tend to be RNs as well, right? And they have additional training as public health specialists?
Yes, or on the job training their nursing skills. While they're maybe not be drawing blood and doing clinical functions, their nursing skills is transferable. That knowledge that they need in order to do investigations and interacting with the healthcare community works very well.
The core of this FEP work really prepared us for our COVID outbreak and our COVID response right now. So it's really fundamental, as Dr. Daly said, it is the fundamental infrastructure we have to prepare for, respond, and recover from any great infectious disease outbreak.
Okay, very good. Are there any other questions here?
Okay.
Okay.
That's the last accounting unit in that bureau, and the very last accounting unit for public health is 1380, which is prescription drug monitoring. And I believe there's a couple of people that need to come over. Lisa, Trish, could you just share with Kevin who that needs to be?
Yeah, so I believe Lindsay Courtney is in the audience right now, who is the director of the Officer of Professional Licensure and Certification, where the PDMP currently resides. And so we've asked Lindsay to join us today. She knows the detail around these budgets. These budgets have just been transferred over to DPHS. And so, you know, as you know, and as we've talked about in our introduction, we know that, you know, the PDMPs are designed to improve both patient safety and improve public health, with the goal of reducing overdose deaths and hospitalizations. And within the governor's budget, there's this notion that we're going to move the program over to DHHS from OPLC.
Okay, and also to prevent future addictions is the other
Correct.
purpose. Yeah. All right. And I'm not seeing general funds under total source of funds. Are there any general funds in here?
None that I am aware of.
I just don't know what's on this next page.
There are funds associated with agency income. What we see on here as well is some cost recoveries, which I'm going to ask our finance people to talk a little bit, or Lindsay to talk about a little bit, and then some transfers that have occurred. One of the reasons why the governor's office was interested in moving this within DHHS is DHHS has a number of federal grants, CDC grants, in which we transfer some of that money over to the prescription drug monitoring program.
It's obviously a good program. The objectives are really good. I don't know how well it's being implemented or executed, but it's the right thing to be doing. So, are there any questions about this from the committee members? Do we want to go to the next one then? It sounds like you were all keyed up to give me a 5-minute briefing on this, but I think we're good, Ms. Tilley.
Thank you.
This is it.
Representative Irf, you have a question?
Just a quick question. So I noticed that the other agency transfers funds dropped way off in the second year in 23. Is there a reason for that?
Commissioner Courtney, could you speak to that, or?
Yeah, I'll take a first swing, and then if Ms. Courtney is here, Attorney Courtney is here, she can fill in if I get it wrong. There are a number of these federal funding sources, and I think it was unclear at the time of the drafting of the budget if there would be rollover or what the exact amount would be in those future years. So we anticipate that we will need to go through some sort of accept and expend process once we have a firmer idea of what those dollars will, how many dollars will be available from those federal funds.
Follow up? Nope. Okay. So I think we can continue unless there's absolutely something you feel like you need to say to us about 1380. I don't want to steal your thunder.
No thunder stolen.
All right.
We're good.
We think it's a great program. We're in agreement that it can move over to DHHS.
All right. So where are we? Are you're summing up? Is this the summation of the public health budget, Ms. Rounds?
It is, and you'll notice that general funds across all of public health did decrease in fiscal year 22, and then went back up a little bit in 23. That completes public health. And so thank you, Lisa, Trish, and Shelley for being on, as well as the bureau chiefs. And I would say congratulations, Division 3. You have now looked at every single page of the DHHS budget.
Been a great pleasure.
Wonderful.
So Representative Irf, your hand is up.
Can I ask you a general question, Karen?
Sure, of course.
Have you had a chance to look at the recently passed federal bill and anticipate what impact that might have on your funding in the coming years?
So I have not. I don't know, is the document out yet? I don't think all of the wording is out quite yet. You may have seen during the presentation, I did get an email from I always say the acronym wrong, but I opened it briefly there. I have some summary documents as to funding we're anticipating. We have made some adjustments in the Medicaid budget. There were some adjustments made in the governor's phase, anticipating that we would get the enhanced FMAP through December, which I think we talked about in the Medicaid budget. Beyond that, I have not had a chance to really think through what impact that might have on the 22 budget.
Thank you.
I think the largest impact really probably is decisions that are not the department's decisions, which is the potential general aid that's coming to the state.
So somewhere in the public health budget, we have money that we contract with the University of New Hampshire to augment about 50% of the salaries of some of the professors. And I had asked before we got into public health, if you would point out to me where we had those contracts. And I don't recall hearing where those were.
So I apologize. I didn't recall that as a question that we needed to respond to. So we will certainly get you that information in public health.
Yeah, I think it's a great opportunity for us to leverage academia, and it helps the university and it helps us. I just would like to understand it better and where it's at and what we're doing and why it's such a smart thing for New Hampshire to be doing.
And we have those spread throughout budgets, several in Dr. Chirala's shop, as well as through our preventive services block grant and other activity areas. But it is spread around because we do really value that partnership.
It sounds like a good one. Representative Rogers, I just want to come back to you. You started the morning with a lot of questions about tobacco cessation and e-cigarettes, and then you were quiet on us. So I'm just curious if you want to speak up before we come off of public health.
No, I just have a concern of if we can possibly add some more money that the governor didn't add in the smoking cessation. But that's probably at a time.
What dollar amount are you thinking?
I'm not sure at this point. I mean, I know that the agency requested 400,000, I guess. So somewhere in any range from 0 to 400,000. I'm not sure at this point.
Okay, no pressure. Well, I'm thinking that on on Thursday, we can begin having some of those detailed kind of questions or conversations after Representative Irf gives us an overview of this afternoon. So,
All right, I'll try to come up with an idea by then.
yes, ma'am. So that's it for the public health. Thank you so much. And I think we're ready for the Veterans Home.
Wonderful. Thank you very much.
Thank you.
Thank you.
You are ready for the Veterans Home. Let me just remove a few people and bring some people over.
Okay, so we've been talking for 2 hours and it's 11:25. While you're bringing them over, let's take a 5-minute bio break for everyone to refill their coffee and et cetera. So we'll come back in a few minutes. How's that?
And Peggy, while they're on break, is there anybody else I should bring over from the attendees list?
Nope, just myself, sir.
Okay,
You get my presentation okay, Kevin?
I did. Thank you.
So it's 11:30. When people return, if you hear me and you've returned, put your video on so I know you're back, please. Representative Bean, Representative Rogers, are you there? I see Representative Rogers. Okay, I think we can get started. I'm really glad the Commandant is here because she's as a veteran, she's getting my bed ready for me. So I'm looking forward to being your guest at some point, hopefully in 3 or 4 decades.
I was going to say at least 3 decades, right, sir?
Yeah, I hope. So, so if Mr. Ripple is ready, I'm ready to hear what you're doing for our veterans these days.
Sure. Well, again, for the record, it's Margaret Lebrecq. I'm the Commandant of the New Hampshire Veterans Home. I want to thank you for the opportunity to make the presentation before you today, talking about the needs of the New Hampshire Veterans Home in the next 2 years. Our budget was put together in compliance with Governor Sununu's requests, and this budget has been prepared with the planning assumption of having 225 residents in our home at that time. For those of you inquiring minds, we have 92 residents living in our home today. We do have 16 residents approved into the tar Welch side of the house, and that is the heavily medical side of the house, as well as 21 veterans waiting to get into our life enhancement dementia unit. I will tell you that my admissions staff is working on approximately 86 active applications at this time. And through that process is when it is determined whether a resident would be best met their needs on the tar side of the house or on the dementia side of the house. And as you can imagine, we only would have a veteran live on the dementia side of the house if he or she is a danger to themselves or as a wandering risk. We never want to put our residents in an area where they are confined at all unless it's absolutely necessary.
Don't you also, though, on the medical side, don't you have a really significant percentage of them that are also suffering to some extent dementia or Alzheimer's?
I would tell you, sir, probably about 85% of those who live here in total have some form of diagnosis, whether it's Parkinson's disease, Alzheimer's, or dementia. If it has not progressed to the point where they are a wandering risk, we would not put them behind the closed doors and allow them to, live in an environment that allows them the best use of their own time. Again, we would only put them on the life enhancement dimension if they were a wandering risk or would benefit from that program because the units are much smaller and is much more, I don't want to use the word quiet, but not a lot more of people coming and going in the areas. So they're less distracted with the stranger danger.
I brought that up because it's my perception that the acuity of your residents is actually more intense than a typical county nursing home. Is that a bad assumption?
I believe that is a correct assumption. We have the comorbidities of our residents who live here. They could have 6 different comorbidities, whether they're living with dementia, COPD, again, a resident who has Parkinson's disease in relationship to whether it was Agent Orange or other, they just seem to be much more frail. And again, our average age is approximately 86 years old. So again, the population is very frail.
Thank you.
All set, sir?
Yep.
Okay, qualified staffing, as you can imagine, particularly in nursing, our LNAs, LPNs, and RNs It's challenging. It has been challenging over the years. We know that this is not just a New Hampshire Veterans Home challenge. This is a challenge across the nation for people to have direct care staff meet the needs of our veterans who live here. So we do have many vacancies that we will continue to recruit for and try to retain those that require, so that we can require, so that we're able to provide the care that is needed. I will tell you currently we have 12 full-time LNA positions across the first, second, and third shift, 8 part-time LNA positions that we're currently recruiting for, 2 full-time, 2 part-time LPNs, which is licensed practical nurses. We are looking for 6 full-time RNs, which are registered nurses, and 2 part-time registered nurses. Again, this has been the trend that we've had over the last couple of years and in prior bienniums, where we are looking for healthcare direct providing staff. Again, our veterans
Curious.
are
I'm
staying
curious
home.
about what that does to your vacancy rate. It feels to me like you've got a 20 to 30% vacancy rate, and I assume you compete geographically with the same nursing staff as Glencliff does.
Yes, Glencliff, although much further north of us, it is the 12 nursing homes that are really around the Lakes region that we compete with, whether that's St. Francis Home, Belknap County Nursing Home, Merrimack County Nursing Home is only about 8 miles down the road from us. So it's a lot of the time we do passive hiring. In other words, we steal their staff and they steal our staff. And again, that goes in a roundabout. So the budget is projected for 225, but with my staffing levels today, we'd be comfortable increasing our census to 175 or 180. And really, once those vacancies get filled, we would feel comfortable going up to the 225.
Thank you. I'll try not to interrupt you. Like I said, I'm looking forward to where my bed is. That's what I.
Sure. Well, we've got a corner office all set for you. Of course, VA regulations do mandate that qualified nursing staff be available on a daily basis, and those are RN positions. And we do ensure that those positions are in-house to meet that regulation. I know that there could have been a question in regards to the footnote in House Bill 2, as well as you would see looking at our budget, the footnote that is after our professional house, which is 5359 on page 188, that talks about the organizational notes. Those were also put in House Bill 2. We have had those for many, many years, and that is directly related to the fact that 2 of our funding sources are based on solely on the census of the residents who reside here. Again, the first, the federal revenue is the per diem revenue that comes from the VA, Veterans Affairs, that gives us $115.62 a day per resident who is actually in bed at 11:59 at night. And I kid you not when I tell you at 11:59 at night, there is a count that's done, and those numbers are verified with the Manchester VA, and that is how we get our monthly per diem.
So Representative Nordgren has a question, and then I also have a question about which section of HB2 you're referring to, because I thought I'd gotten to be very familiar with HB2, and I don't know which section or paragraph you're referring to.
Sure. On House Bill 2, number 47, which allows the New Hampshire Veterans Home to transfer funds within the accounting units. If you look in the actual detail, which is line number 106, which allows me to have unfunded position and move funds around, that's directly related to staffing, as well as 107. But the footnote is 108 that talks about if during the biennium projected revenues are more, I can go before fiscal and ask for those funds to be accepted. And it also allows, if it's less, that my appropriation will not be lowered because of those revenues not coming in because they're directly related to the census. And of course, I can't increase the census if I'm not able to fill the positions because I have to cut positions because I don't have the census. So
So
it's kind of,
Representative Nordgren, thank you for your patience. What, do you have a question?
Yeah, I just wanted to know if your salaries were large enough so you were able to compete with the nursing homes. I think that was an issue we had with Glencliff, and I wanted to make sure you had enough viability in your salary line to be able to hire people if available. Thanks.
thank you, ma'am, for that question. Yes, the New Hampshire Veterans Home has gone before Governor and Council over the last couple of years and asked for an increase or an enhancement to our nursing salaries in order to make us competitive. So I do appreciate that question.
Okay,
So the second part of the per diem, of course, is those veterans who are 70 to 100% service connected. And the New Hampshire Veterans Home receives $453.84 for a service connected veteran to live at the home. And that does pay for the total cost. In that MOU with the Veterans Administration, if we are accepting the higher per diem, we are not allowed to charge room and board to that resident because it covers the total cost of care. And speaking of the room and board is the next one. The agency income is based solely again on resident census. We look at each one of our residents separately based on their income. If their income, or excuse me, if their assets are above a certain level, they are charged a full room and board until their assets are below the level that is under our administrative rules, which allows once it's under, it's 90% of their income. If their assets are above $30,000, then they are charged $320 a day, which is the average that's being charged throughout the Lakes Region area. So we try to make sure that, and quite honestly, if you take the $320 plus the per diem of $115, that is our total cost of our care. So we feel that we shouldn't be charging our residents any more than what it cost us to care for them. Any questions on per diem or room and board? And again, those are laid out through our administrative rules. Of course,
you have a slide deck you're going to walk us through. Mr. Ripple, did you send something earlier on Veterans Home?
I only had the verbal presentation. Sure, we did not have a PowerPoint.
Okay.
The third funding source, of course, is general funds. And so we would, again, ask that we be allowed the footnotes that are after our budget to allow us to continue with our census and increasing that census as we go throughout the biennium. The other upcoming needs of the New Hampshire Veterans Home, of course, is new and replacement equipments, whether that's beds or overhead lifts. And obviously those overhead lifts are because of the greater care needs of our veterans. The challenges that we see ahead are women health care, bariatric care, hospice care, dementia with behavioral disturbances, and we do see an increase in our Vietnam veterans being admitted to the New Hampshire Veterans Home.
So I think it's fine that you don't have PowerPoints. I don't know how you have veterans around you and not do PowerPoint, but it's sort of an inside joke. But if we could, maybe we could visualize using the spreadsheets. So if we could go maybe share the veterans spreadsheet and some of the points that you're making may be related to an income line or an expense line. And
Sure.
that way we could use the visual ability and our hearing ability together.
Absolutely. Kevin, are you going to bring up the New Hampshire Veterans Home? It's 1186 is the professional.
Yep, I can do that.
Okay. And next time, Representative, I'll make sure I have a PowerPoint presentation for you.
At least one with your name on it. That way, you know, you can put the check in the box.
Okay.
Sorry, it's taking me just a second to find it here.
So while he's doing that, I have a trivia question for you. You said that you get a higher reimbursement rate for people with a 70% disability. I'm one of those people that have like a 90% disability that they've adjusted down to 70%. And a big part of my disability is related to sleep apnea. Are there other rules that would keep me from qualifying in that 70 to 100% disability level?
No, sir. You would, at any veteran who has 70 to 100% service-connected disability comes and lives at the New Hampshire Veterans Home free of charge from their income and is paid for in total by the Veterans Administration. The only thing that would keep you out is if you were a danger to others, if you were violent, and or we were unable to meet your needs medically.
Sorry, one moment here as I.
Sure. It starts out on, Kevin, ours starts at page 1185. Halfway
Okay.
down the page, it starts on our custodial care. And again,
And what-
1185.
Yeah.
About halfway down, you'll see New Hampshire Veterans Home, and that's the Veterans Home Custodial Care. 5358 is all of those positions at the New Hampshire Veterans Home that are not direct care. So they could be laundry workers, environmental services, which is our housekeepers, our maintenance crew. And again, that part of the budget is 100% general funds. And that's a little over 8 million in the first biennium and 8.3 in 23.
What's your head count for that? Could you scroll down a little more?
That's 94 full-time positions, sir.
Okay, how are you doing on vacancies here in this kind of?
Actually, we do have vacancies, again, hit or miss, whether there's retirees and housekeeping and laundry and our maintenance guys. We do have a hard time getting people to work second and third shift in maintenance and housekeeping. So those are, you know, we have a 25% turnover in those positions. It seems that we get them filled, but again, night shift is not for everyone. So we try hard to, as people stay on that shift, if a daytime vacancy occurs, a lot of them will apply for those. And so then we're again filling second and third shift.
Okay, what do you think accounted for your general funds jumping from 7.3 million in 20 to 8.8 in 21?
Again, it's those vacancies and turnover and people who retire and the position gets left open for a period of time. In 22 and 23 is showing the full vacancy of those positions. But in 20, you see the amount go down because the positions were not always filled.
Yeah, I understand. So you're probably going to have another decrease because of the hiring lag for your.
It really, yes, sir. It certainly is a challenge, and dietary is another one of the positions there where we have a constantly looking for dietary positions. And so again, we don't spend it if we don't, if the position is vacant, then the money does not get spent. But again, we do ask that it be fully funded so that we're able to recruit into those positions.
Right. And where is the money that you're spending from that personnel line when you go and just contract with a maintenance company or something?
We have a snow plowing contract. As you see, if you look over to 103 contract for operations services, that's the contract. They do snow plowing for us. We do not contract for any maintenance, housekeeping, and or laundry at this time. They are positions funded.
Very good. I don't, are there any questions in this area for the Commandant? We can go on.
So 5359 is the professional care. This one obviously is much more detail, and this is broken down, shows you the federal per diem, as well as the room and boards that is charged to our veterans. Again, you will see the actual expense in 2020 for our personal services was 11.5 million. We are asking for our positions to be fully funded so that we are able to actively recruit for those positions. But again, if the positions are not filled, that money does lapse back to general funds, lapse back to the fund as it is allocated below. The reason, again, why we ask that we are allowed the transfer between, we do have an outside contract with an agency, temporary agency for direct care positions. We have not had a lot of success with that, but we have had a couple of nurses and a couple of LNAs from that. And as you can see, if you look at 101 medical payments to providers, the $242,000 and change that was expended in 2020, that represents a couple of RNs and LNAs that helped us out. Again, we only spend it if we need it. And so we are able to transfer between that line and our temporary services, class 10 and class 101, so that if we were able to get a full-time person, that's always what we want to do. We want somebody with consistent care to our veterans. But if the need is there and the agency has somebody that they can offer to us, we want to be able to expend that out of class 101. Again, that is a.
Tell me about 021, food institutions.
Institutional food line, and that is exactly what it states. That's that's our dietary budget, and for the foods, whether it's steak or hot dogs. Hot dogs and beans is a Saturday favorite. Pasta or some other kind of spaghetti on Wednesdays. So that is solely food, institutional food line.
Or your nutritionists and cooks in this? They're in this, their payroll isn't here?
Their payroll would be under class 10. Yeah, so I have 2 dietitians. I have a dietitian's assistant. We have somebody that's constantly monitoring our residents to make sure that that they're meeting their caloric intake and offering different protein shakes or drinks if their weight dips below a certain percentage.
So show us the personnel line, if you would, Mr. Ripple.
Class 10, sir.
No,
Right
the
there.
number of humans.
Oh, the number of humans is, I'm sorry, 289 full-time and 1 unclassified, and that is myself. So again, we have currently, we are actively recruiting for 32 vacancies in that line, although we do have others that are vacant at this time. I don't know right off the top of my head the ones that are totally filled, because we always have a little bit of influx between the two.
I can imagine. So are there any questions in this area? I'm not seeing any. And then here's where you want to draw our attention, I think, to the organization note.
Yes, this is the footnote that I feel is very important that the home has, so that we're able to actively recruit even when our census is low. I think that we need to be able to actively recruit, and if based on our census obviously due to the devastation of COVID-19, our census is lower than it would normally be. We were unable to do admissions most of last year. We are starting our admissions on March 30th. So we're hoping to get more veterans in the home. But if we were to lose our appropriation based on the fact that our census was down, we would have a hard time paying those bills.
Okay, so I'm going to talk to the committee members a second.
Sure.
I had not anticipated us going through the organization notes, the footnotes, and having separate votes on them to make sure that we're okay with them. And because of that, I'd like to just ask if there is a committee member now who has a problem with this organizational note, because if we don't have, if no one has a problem with it, I'd like to just have us all assume that this is an acceptable organizational note and move on. So think about it, Representative Erf.
So I don't have a problem with it, but if I'm not mistaken, it is actually one of the HB2 numbers. I think it's number 107. Isn't that what you said, Commandant?
You said 47?
107, 107. So I believe we'll be considering, I mean, I agree with it, but I think we'll be considering when we go through HB2, I think there are 3 veterans items in there, number 106, number 107, and number 108, Commandant. Is that correct?
That is correct, sir.
Okay, so those aren't on my radar as HB2 items.
Well,
you're
you may recall just yesterday when we were going through it, somebody brought up jumping ahead and you said, well, we're just doing DHHS, and that was, the jumping ahead was to the veterans, the 3 veterans.
Oh, that's why I don't know these HB2s, because we haven't looked at the veterans yet.
Correct.
Oh, so we will have to schedule a discussion and vote on these. All right.
Well, you can do it as you please, but I just want to point out to you that they are.
No. I once we've got a process, let's use the process. I just thought for some reason that I knew all our HB2s and I'd overlooked these. Okay. All right. Well, so we will be talking about these later and getting a vote on them. I'm not seeing anyone disputing it though, so it shouldn't be an issue. All right, we can go on.
Sure. So 5360 is our pharmacy services, and they are exactly what they proclaim to be. We do have a contract with consultants that provide us with pharmacists and pharmacist technicians. As you can see, that's under 046 for consultants, and the rest is exactly what it is prescription drug expenses. We do use the McKesson, which is the VA's formulary, and we get, I believe, a great rate for our pharmaceuticals. Again, as you can see in 2020, where our census was down, we just spent a little bit under $560,000. We are asking going forward for $800,000 to make sure that we're able to meet the needs of the census as it gets, as it increases. The consultant, again, the consultant line is exactly that, what was approved through Governor and Council contract.
So if you have a veteran who's living at home and they're receiving mail order prescriptions from the VA pharmacy, then they become a resident in your home. Do they still draw their mail order, or do you halt that somehow and you divert it into this program?
So we alert the formulary or the VA that they are moving to the New Hampshire Veterans Home. So they would no longer be receiving it via mail. They would receive it from our pharmacy here at the New Hampshire Veterans Home, and we would ask for our reimbursement through our internal process. If they are 70 to 100%, then in that per diem rate is included the cost of pharmaceuticals.
Okay. So I'm just a little confused why the line 100 prescription drug expenses is so high, because I'm thinking if the VA is just paying for them, that line would be near zero.
No, sir. Most of the veterans who live with us are of a different category lines. And so only certain service-connected drugs are covered, not all of the drugs that they have. The service-connected are different, the 70 to 100%. But again, I only have a handful of those who are 70 to 100% based on overall population.
Okay, good explanation. Thank you.
Yep.
Do you want to talk about this organization note, or have we already talked about this?
It's the exact same note that resides under 5359. It just allows for a total appropriation to remain if the amount of reimbursements go down based on the service connected or the veterans who are not service connected, I would say.
Okay, we can go to the next activity.
Sure. The next one is 8147, which is workers' compensation, which we do not have a whole lot of control over, as you can imagine. And so those numbers are based on what we feel has happened in the past. And so we're just rolling those forward. It's pretty flat numbers.
All right.
The next is 6162, unemployment compensation. Again, a very small lines, and those are 100% general funds. Little over 18,000.
All right.
And that takes us to the end of the New Hampshire Veterans Home. And as you can see, we have 383 full-time equivalents as one unclassified, and that's exactly what we've asked for going forward.
All right, so let me ask you a question and tell you in advance, I really just want a yes or a no answer. Okay, not a long answer, just a yes or a no. We had a number of deaths due to COVID in the Veterans Home. Have you and your staff completed an internal review and come to identify the causes that may have contributed, or the potential contributing causes? And have you taken the remediation steps necessary to deal with those causes?
Yes.
Yes. Do you need, is there any additional program, equipment, supply that you would need to keep your remediation efforts in place?
No, I feel that we've, that is in our budget for 22 and 23 and we're in good shape going forward.
So Representative Weiler, you have a question?
Thank you, Mr. Chairman. Do you have any large debts, like fuel and utilities we've seen in the past?
No, sir, we're totally paid up on all of our bills and our accounts payable lines. Thank you.
Any other questions here? Okay, so that's really it, Commandant. I do have another trivia question for you. Okay, about 6 months or so ago, I had a roundabout complaint forwarded to me by one of your residents that originated with one of your residents. And it was related to the idea that because of the way that Wi-Fi was provided inside the building, that all of the residents who had internet accounts needed to go directly to their own commercial providers of the internet. And that created a lot of contention and network problems for them. There was some discussion with DOIT of expanding the government side of the Wi-Fi and segmenting it so that the residents could use a single point of access instead of having to go for their own commercial version. I understand that a decision was made to require the residents to continue getting their own commercial carrier for internet service instead of expanding the state network. Do you remember this? Do you have anything?
I do, sir. And after you had reached out to me, I reached out to DOIT and asked them to explain to me in detail exactly what they were offering, because we had had such a hard time at the home even getting a commercial provider to come in with the concrete walls as the home has been built, and the different dark spots that we have around the building. And I apologize, I don't remember their exact response, but someone had reached out and said that there was a cost, quite a large cost to this, but that cost could be then diverted off to our residents, which I must tell you that I'm taking 90% of their income just for them to live here. So I had a hard time going forward with a cost that I didn't know how much more it was going to cost them. Where Atlantic Broadband was the only people who had bid on, when we went out to bid, asking for a company to come in and provide. computer services for our residents. I will tell you that we provide basic services throughout the home, basic TV. But if they wanted an additional or a computer with a phone attached to it, that they had to do that on their own because of the cost. And I don't know the exact amount that DOIT was talking about, but it didn't sound like a small amount, sir.
All right.
And a small amount of work that needed to be done in order to increase the bandwidth here at the home and to have that. Because again, if the residents are by the library or by the town hall, they are able to access the Wi-Fi that is available to them free of charge. Unfortunately, we are not able to bounce that throughout the home because we do have our medical carts that need to be on a segregated due to the HIPAA guidance. So we need to make sure that it absolutely has to be locked down. We can't have any HIPAA or PHI issues going on. Our med carts are on Wi-Fi, and so it was very concerning that we would have two potential signals being thrown out through the home, and that our med carts would pick up on that and be have an issue with the transmission of the medical record.
So let me translate that into what's important to me that I think I heard you say. That if the resident is able to move to known locations in the health center, that they can get good, strong internet access at no cost to them.
That is correct. And we have a computer room called the Ben Pen, what did we call it? I'm sorry, I've lost my mind. We've got 3 free computers that sit in a room that they can go and they can access, whether they're Skyping with their family, their loved ones, they have computer access. We just do not provide computer access in their individual rooms. If they're over by the library, over by our Main Street area, they're able to access the internet free. The Wi-Fi is there free. We are not able to blast it across the entire house.
Oh, I get it. So I'm just curious with the lockdown, you don't call it lockdown, but with the segregated Alzheimer dementia unit where they are kept securely because there are escape risks.
Yeah.
Are they able to go to the portion of your building where they need internet access, or maybe the real answer there is they have a mental condition that really makes it so they're not internet seeking people to begin with?
That is correct. But if there's a family member who wants to reach out to one of our veterans in that area, they're able to take a secure laptop or tablet over there and interact and set it up so that resident is able to communicate to their loved ones from their unit where they're safe and secure.
So it sounds to me from what you've said that we share a common concern that particularly with COVID and the inability of families to come in, that this Skyping and Zooming is vastly more important than it was over a year ago.
Absolutely. We have about 15 currently laptops, iPads, tablets, and our recreational staff who have access to Wi-Fi, and they're able to get around to the residents whose family, and again, they set up specific times that they're either phone calls, again, Skyping, FaceTiming, so that these families and their loved ones are able to communicate. As well as window visits. As you know, we have areas around the building that is clear glass. Some of our family members have said, it's too hard to come in and have a mask on and be 6 feet away. I can't hear him, he can't hear me. I would rather do a window visit. And so we set them up with a lawn chair and or a comfortable chair on the outside of a glass window, and their loved ones on the inside, and they're on cell phones talking to each other because they can hear each other better.
I'd like to change the topic of the conversation about and that's all. Those are all great answers. I just wanted to follow up with you and see if you needed more money for repeaters, internet repeaters, and it doesn't sound like you do. But the other question is, 2 years ago or so, maybe it's been 3 and time flies, but I came out and did a site visit with you. I don't know if you remember, to look at whether or not the VA Manchester or the VA in Vermont would provide you with telemedicine support. And if that telemedicine support, in theory, if it was going to be able to help you reduce your personnel requirements. Has there been telemedicine put into place, and what effect, if any, has it had on your personnel needs?
Actually, we had some of our residents, as you know, who still travel down. So we have to do transportation down to the VA or to a CBOC that they're receiving mental health. So we have had mental health come in. The VA issued us a specific laptop that they felt met their guidelines to the VA needs in order for one of their providers to provide telehealth medicine to our veterans. And so we started that probably the end of August last year. And from the amount that, or the conversations I've had with my staff, it seems to be going quite well. Some of our residents are okay with that. Others don't care for it. So we work around what our residents feel comfortable doing.
Okay, so it sounds like it's relieved a little bit of pressure on the fact that you have vacancies, but you're not ready to get rid of any permanent positions because of it.
No, because unfortunately, we have plenty of our residents who still need to go to outside providers for different things. And so,
Okay. No, I get it. So are there any questions from any of the committee members? I really appreciate you coming in and talking with us. And frankly, just having you talk directly to the spreadsheet, I think was very efficient. And for me, it was effective. So I wouldn't say that you should be concerned you didn't have any PowerPoint. Just other than I've never seen a military briefing without one, so I didn't know it was possible. But all right, I don't have any further questions. Does anyone in the committee? I'm not seeing any, so I think you can go have a great day.
thank you, sir. Thank you for allowing me to present before you, and I hope you all have a great day.
Thank you. So Mr. Ripple, I think we're getting close to lunchtime. I think when we come back from lunch, I want us to go look at section 22 of HBA and see if we can approve it. Then we'll have Representative Wallner kind of introduce us to the topic of section 39, the Forensic Mental Health Hospital. We'll go talk about how we might do a quick sort on some of the accounts so we have a smaller target of mass. And then HB1, Representative Earth will talk about that and introduce us. So I still think we have a pretty full and productive afternoon. Representative Wallner, let's go with Nordgren first because she raised her hand first. Representative Nordgren.
Thank you, Mr. Chair. And at lunchtime, I will send an email out about the Division 3 comments we have on various budgets we think we could pass.
Okay, that'd be great. And then we'll try to talk about them then. We'll look at your email. Yeah, thank you. It's very helpful. Appreciate it. Representative Wallner.
I just have a request of Kevin. So Kevin, when we talk about section 39, could you just have the language from the previous budget available so that we can see the language that was in House Bill? I guess it was in House Bill 4.
Yep, sure, I can bring that up.
Okay, and I guess I could just forward it to everyone, but Senate Bill 156.
Okay.
Okay, great, thank you.
Is that from a prior year, Senate Bill 156?
No, it's there now. They've had a hearing on it.
Okay, thank you.
Okay, yeah.
Yep. All right, so Mr. Ripple, I'm ready to go to recess. Do you have anything for us before we break for lunch?
I do not.
If if you wouldn't mind putting up a sign that we'll come back at 1. And I don't know, I don't think we need to have the recording on while we're at lunch. I don't know. You know?
Nope, I'll stop the recording.
Okay, good. And we're recording. So Division 3 is coming out of its lunch break. When we broke, we said that we would come back and we would start by discussing Section 22 of House Bill 2. If you have the March Madness calendar, there's the link there to the official website where the language should be. So let's everyone get on to it. Oh no, that didn't work.
I do have section 22 pulled up here, so I can share my screen if that doesn't work.
Oh, that's probably helpful. I just, okay, I found it. Well, it's better to share it anyways, so that we know that we're looking at the same thing, if you wouldn't
Okay.
mind. These are the repeals. My notes on this, we were thinking instead of a repeal, maybe suspend it. Then we heard from Ms. Altman, who said that she thought that repeal was still the right way to go. There was some question of whether or not the congregate housing is the main issue and if it should be separated from the grandfather or the grandparent foster program. So I think if I remember right, Representative Wallner, you had the concern about whether this should be a suspension instead of a repeal. Am I remembering that right?
Yes, mainly because they were in the last budget.
So did Ms. Altman's remarks placate you any, or because she's still advocating for a repeal?
You know what, it doesn't really matter. I think that this is a very popular program with some people in the Senate, so we'll probably see it again.
So so we're repealing 3 sections of the RSA here. I'd like to hear a motion. Is there a motion to accept House Bill 2, Section 22?
I would make a motion to repeal as specified in number 22 of HB 2.
So say your motion again. I missed it.
Can't turn that off, I'm sorry. I would move that we accept House Bill 2, number 22, which is repealing several RSAs. I'm going to read them to you.
So I understand that motion. Is there a second? Representative Weiler seconds.
Second.
Is there any discussion?
Sorry.
Go ahead. You're recognized, Representative Wallner.
Okay, I am going to vote no.
Okay, because you think this should be a suspension instead of a repeal.
I think it should just be a suspension.
Yeah. Okay, is there any other discussion? I'm not seeing any. I think the clerk, if you would please call the roll.
Representative Erb,
Yes.
Representative Weiler votes yes. Representative Bean,
Yes.
Representative Wallner,
No.
Representative Nordgren,
No.
Representative Rogers,
No,
Representative Edwards.
Yes.
Vote is 4-3.
Okay. All right. So so we'll be going forward with a repeal, and then Representative Wallner, I know you have friends in the Senate. Maybe we'll see this again.
You might.
Okay. Okay, so Representative, or excuse me, Mr. Ripple.
Yes.
Would you slide down to section 39, or really whatever Representative Wallner wants to do now? She has the floor for section 39.
So section 39 is the section that pertains to the psychiatric forensic unit. So Kevin, maybe we could show. So are people feeling familiar with what was in House Bill 2? It really was $17.25 million to construct a 60-bed forensic hospital. And it directs that the department would use federal funding if it's available, yes, to pay for it. And if it's not, then the 17.250 would be bonded. So I was kind of concerned about that because I wondered how you did that outside the capital budget, and I had concerns about the capital budget. So I did it over the weekend, just did a little research about what kinds of bills have we had before. We've had a number of bills around this. Most of them set up study committees and oversight committees. But there is right now a bill in the Senate. It's Senate Bill 156. And it will be on the floor on Thursday. And the motion will be to re-refer it in the Senate. So they're obviously holding it in the Senate. What this bill does is basically, and I'll show you what was in the in House Bill 4 from this period. It basically is a sum of $8.75 million. It's a 25-bed psychiatric facility. It cannot be contracted out to a private provider. Let's see, I can't remember exactly. The management of the secure psychiatric unit facility shall be the responsibility of the Department of Health and Human Services, and the department may contract with a private psychiatric service provider, but shall not enter into a contract for the construction or operation of the facility with a private for-profit prison construction or management company. So that's what the Senate bill says. And now, Kevin, can we go to show what was in House before?
Sure.
When you're ready for a question, I think Representative Burke has his hands up.
Oh, okay, I'm fine. Question, fine.
Thank you, Representative Wallner. Maybe I'm misreading this, but when I read this HB 2 Section 3, it sounds to me like they're asking for another 17 million quarter on top of what, as I recall, was in the original HB 4. So they're looking at like $35 million total. So I have that right?
I'm not really sure, but I would like to look at, I'm not really sure if they're adding it on it. See, they already have the authority.
Right.
They already have the authority to get 8.75 million to build a 25-unit, 25-bed hospital. And
that's SB 156 though, right? Didn't our last HB 4 include a 60-bed unit with more money, like $17 million?
No. Can we go to House Bill 4?
Sorry.
Yep.
Okay, here's House Bill 4. This is what we did 2 years ago. It's 8.75, and it is a 25-bed hospital. And this, they did not spend down. Is that right, Kevin? They didn't spend this down.
That's my understanding, and that's why in the current trailer bill, it starts with the department shall proceed with the construction of a 60-bed facility utilizing funds appropriated in the fiscal year ending June 30th, 2021. So I believe that references the original 8.75 million.
Right. So they already have the authority for the 8.75. So this, it seems to me like we could almost take out what's in here and just, they already have the authority for the 8.75. And they can proceed with, that gives them the right to proceed with the 25-bed hospital.
So but they've increased it to a 60-bed hospital.
They increased it in House Bill 2. They requested an increase to 60.
Okay, so they're authorized for 25 beds and they have some money authorized. And the money that was authorized is non-lapsing. It's still good even if it goes into the next fiscal year?
That's true. It says here, the sum appropriated shall be non-lapsing, provided that any unexpected amount following construction shall lapse to the general fund.
So what is it a correct understanding then that what they're doing is increasing the bed count from 25 to 60, increasing the costs associated with it, and creating an avenue to bonding to get the extra money if we don't appropriate it? Is that a correct understanding?
That sounds, yes, that's what it looks like House Bill 2 is doing.
Yeah. So
that's my understanding too. I just would note that Karen does have her hand raised.
Yeah, I was about to go to Representative Rounds next.
Okay.
Karen, go ahead.
Thank you. Kevin, if you don't mind just bringing over Joe Caristi as well, because there may be some questions that are a little more in depth that he might be able to answer. But just to give a little bit more history, the appropriation that was in the final House Bill 4 was for a 25-bed unit, and the amount appropriated was only half the amount that was needed to construct that 25-bed unit. The idea being that we would only need half the funds last biennium to start the construction, and additional funds would be appropriated in 22-23. The original proposal made by the department and the governor that were in the House Bill 2 as introduced in 2021 was a 60-bed unit that I believe was closer to that $40 million number that was mentioned earlier.
So if you want to hand it off to Mr. Christie, that's fine with me. But we're just talking.
Joe, do you have anything else you would add as background or current information?
I don't. I apologize. I was being brought over when you were speaking, so I didn't quite hear everything that you had just said, Karen. But in general, the initial construction for a 25-bed facility was estimated to be around 16.5 million, half of which was appropriated last biennium. And as Karen mentioned at the end of her point there, the department's and the governor's initial proposal was 60 beds.
So Representative Weiler, your hand was up.
Thank you, Mr. Chair. Now, a lot of what we've been looking at lately and reviewing is how much people are in emergency departments because there's no bed for them and all this kind of delay and all that. And we get emails as well about that. So is this 60 versus 25 because of all this pressure? It seems like we have an increase in mental health problems. Is that true?
No.
So again, this is Joe Caristi, CFO of New Hampshire Hospital. So the increase to 60 beds is not necessarily a reflection of the emergency boarding room crisis that's grown over the pandemic. This facility is really targeted more at the forensic patient population. who, many of which are currently housed at Department of Corrections. There would be some patients at New Hampshire Hospital that would be appropriate for this facility, and so in that regard, it would free up some capacity for individuals in emergency rooms, but that's not necessarily the primary intent here. It's more about those individuals who are currently housed at Department of Corrections, but maybe don't have any sort of commitment per se. And so I believe that's really where this came from. I joined the team right around committee of conference when this was being discussed. So.
Want to have a follow-up?
Yes, sir.
If these people move from the prison where they're housed now, does that mean that we'll have lower costs in corrections at some point?
I don't know that we can speak for corrections. I don't know the definite answer to that, but I don't know how many people they have in their facility, but they would no longer be there.
Thank you.
Representative Norgren.
Thank you, Mr. Chair. Maybe Karen can follow up with us on how many they have over at the Concord prison. That would be helpful. The other thing I would bring up again, I think we discussed, is that none of this seems to be going through the capital budget and the Public Works Committee. And the bonding outside of House Bill 2 doesn't sound very reasonable. Anyway, just a comment and a question. Thank you.
So my understanding from the governor's office is that, and I think I provided this information, but that the intent of the federal funds would be the federal stimulus funds in the bill that just passed at the federal level. We don't have any other department funds federally that we could use for this purpose. Most of our grants do not allow us to build infrastructure. We can often repair things and that type of thing, but we cannot build infrastructure. As far as the bonding goes, my understanding is that the intent was that if the federal stimulus dollars were not available, that in a later phase of the budget, when we knew for sure that they were not available, we would work in all likelihood with the Senate at this point to try to work that into the capital budget.
Representative Wallner.
I think, and I was just looking to see if I had it. I was wondering how what I was sitting here wondering was how many people there are at the prison now that would transfer over to this type of a facility. And I believe the Senate did get some testimony around that, or at least some information about that. So I think the Department of Corrections could provide that for us. And someone sent me an email about it, and I'm just trying to see if I can locate it.
So if I could append to your question, the extended part of the question, which is, we're not seeing any prospective headcount for how many people need to be needed to staff a 60-bed forensic hospital. And it could be quite significant. And so we ought to be looking at the manpower and personnel costs in total, I think.
So go ahead, sorry.
For staffing this hospital, if we build it, we need to operate it. So I'm just curious what the head count would be to man this hospital, and to Representative Wallner's question, what number of them are being transferred from the prison system? Because these are still criminal, mentally ill people, right?
No, not always.
Not always. Sometimes they're held because they're not guilty for reason of insanity or unfit to stand trial, and so therefore have not been convicted. I think that we have done the analysis on what a staffing model might look like. Of course, the staff wouldn't come into play until the 24-25 biennium, but I think we could provide you with what we have estimated the staffing model to look like. It's a little early to know for sure until we know exactly what the building will look like. So the design phase is done, but we can give you an estimate.
So Representative Weiler, question?
Thank you. We keep seeing the statistics of people waiting in emergency rooms. What are we doing about it, and this and that? We passed this 2 years ago and nothing's happened. So we see an opportunity, I think, in the next month or two to find out we've got money coming from the feds to help build this. And I think the best thing we can do right now is pass it and see what we've got 2 more months before we see what's going to happen in the future. And already been delayed, in my mind, two years. So I think I would just assume, rather than delay, pass this out and send it along as it comes to us. Thank you.
So I have a question about what you just said, and then we'll go to Representative Wallner and Nordgren. Has the department clearly stated, because I don't recall it, have they clearly stated that this 60-bed facility will directly influence the reduction of the warehousing of mentally ill patients in emergency rooms?
No.
So I'll let Joe add. He does have his hand raised too, so I'll speak first and then would ask to let Joe speak. So when we testified back when it was a 60-bed facility, yes, it would most certainly free up beds at New Hampshire Hospital. If it was a 25-bed facility, I believe it only replaces the secure psychiatric unit at the prison. So maybe that's the answer for the number of beds, but we'll get you that as well. But it would absolutely free up beds at New Hampshire Hospital. Joe?
And therefore get the warehousing at emergency rooms down.
It would open up beds at New Hampshire Hospital to allow more more people from the hospital, yes.
Okay, and then Joe, did you want to, you raised your hand right as she was speaking. Are you got a joint answer?
I just wanted to confirm what she said. So at the 60-bed level, that would be where New Hampshire Hospital would be able to free up some additional census. The facility at a 25-bed unit likely would not impact emergency room boarding. It would solve more of an issue where we have civilly committed or not guilty by reason of insanity individuals housed in a Department of Corrections facility.
Thank you. Representative Wallner?
Karen, I just wondered if we do we have any guidance from the federal government as to whether they will, in this new round of funding, allow us to do capital projects?
I have not had an opportunity to read the summaries on those funds. I've only focused on the stuff that's been specific to HHS so far.
And Mr. Chair, I was just wondering if you might want to ask if there's anyone in the audience who has information around this. I know that 2 years ago when we looked at this, there were people who had taken a long look at this kind of a forensic hospital and had information about it.
Okay, we can do that. Representative Rogers has her hand up. Let's address her first, and then we could go to the audience.
Mr. Chairman, I'm just concerned. A lot of the questions we're asking today were the same questions we were asking 2 years ago, and we're not getting answers still. But one thing that concerns me, and maybe Ms. Rounds can answer this, 2 years ago, we asked if my city, Concord, had ever been approached about this facility and about what it would mean, since this is going to be put in on the state hospital grounds, which is located between two schools, the junior high school and the senior high school, and next to a daycare center in the city. And we asked if they'd done anything by contacting the city and asking for their input in it. And we were told they had. And then when I talked to the mayor, he'd never heard of it. I'm going to ask again and hope for an honest answer this time. Has the city been involved in any of the planning, if any's been done, Karen?
So if I could just, okay, so you used the word honest there. I think what we're looking for is a correct answer. I don't
All
think we
right,
want to
correct answer then.
get lied to.
I am not aware of what conversations have been happening. Joe, can you, he's saying yes, he's aware. So I'll let Joe jump in there.
Sure. We actually, in the most recent design meeting we had with our colleagues down at Public Works, that was one of the first things that we talked about was needing to reach out and engage with the city of Concord around this. And I believe, and please don't take me as the expert on this, but I believe any major project that happens in the state office complex, I believe it actually has to be coordinated with the city of Concord. So, but that is certainly our intention.
So you intend to talk to them, but you haven't talked to them yet.
The design engineers down at Public Works may have. I'm more on the finance side of this project, so I don't want to give you a false answer. But we did just actively discuss that.
I'm just concerned it's been an additional 2 years and the city hasn't been involved in any of this. And it does have an impact. I know that the state quite often doesn't think it does impact our city, but it does. And I'm concerned that in 2 years' time, there's not been contact and they haven't been intimately involved with a 60-bed unit of forensic mentally ill people and people coming in. I understand the need for it, but I also represent the city of Concord, where we have individuals, and I'm very concerned that in 2 years' time, Mr. Chairman, the department hasn't found the need to do anything but think about reaching out. So that's one thing that concerns me, but it also concerns me that a lot of the questions we're asking here today were questions we asked 2 years ago. And it started out as a 25-bed unit and now it's a 60-bed unit. So I have great concerns about this project. It doesn't seem, 2 years ago, it wasn't well planned out, and it doesn't seem very well planned out now when they've had 2 years to work on design and everything else. And it doesn't seem much has been done, frankly.
Okay, so thank you for those comments. Just to remind the committee, today was scheduled to make sure that we talk through this section, and we weren't going to vote on it until Thursday, in case there's follow-up issues and the like. I would like to share a part of a conversation that Representative Wallner and I had this weekend, and Representative Wallner, if I misremember any of this, please correct me. But I think when we talked about this, I said that my concerns around this is that this really feels like it needs to go through the legislative process and have a full committee looking at it and a fiscal note attached to it, and that we were doing a capital project in an HB2, and I'm the new guy, so I don't know if that's a good thing to do or a bad thing, but it feels to me like we have capital budgets for a reason, and this looks like it may be circumventing that. So what I think I laid out to Representative Wallner was the possibility of taking this out of HB2 from the House version of it, letting the Senate work on their bill, but meanwhile, in early April, our committee could have more of a hearing where we invite people in so we can behave more like a committee, a policy committee, than just a finance committee. So that was sort of one idea that got floated that's very different than what you said earlier, Representative Weiler, and I want to respect that. And Representative Nordgren, you don't have to take your hand down. I wasn't going to talk forever, and you can talk now. You're on mute, though.
You probably said everything I was already thinking. I was thinking, if nothing else, we could remove this from our version of House Bill 2 and then send it to the Senate, and hopefully we'd have more information on how to proceed. But I think you're on the right track. Thanks.
All right, Representative Wallner, since I was citing our conversation, did I miss something?
No, I think that pretty much summed it up. I was excited when I saw that the Senate did have a bill, and that the bill actually matched sort of what was in the budget from 2 years ago. But they have re-referred it. They're holding on to it. So there's obviously going to be a time when the Senate and the House are going to be able to talk about this. So possibly holding an information session later on in April when we have more time. I think there's merit to that.
Representative Nordgren, your hand was up and then down. Do you have another comment? No. Representative Weiler, since what I said kind of contradicts what you were recommending, what are your thoughts?
Probably that'll work the way you propose, and I think Representative Wallner considers it the same, and we've got enough time before we have a deadline. I just wanted to move it along because I thought, but your plan would move it along one way or the other, so I would go with that.
Okay. So what I think we'll do on Thursday, and this will give people a chance to think about it. And I think we'll probably have a motion to vote to remove Section 39 of our version of House Bill 2, with the idea that we would begin scheduling more of a policy committee review of this in early April, so that our committee can get smarter about this and get ready to give some of that information to the Senate if they don't already have it with their hearings on SB 156, or alternatively make us smarter so we're prepared for the committee of conference. That's what I think we might vote on Monday, or excuse me, Thursday. Are there any comments, Mr. Ripple? What do you're being quiet as you normally do in this phase of the conversation, but I'm curious what you're thinking.
Nope, I think that's fine. I would just note two things. One, you do have one hand up in the audience if you want to hear from that person. And another, if you vote to remove it, I don't think it would just be a vote to remove as you've been voting to approve so far. You would actually need an amendment that removes that section, but we can have that prepared.
All right. So let's go to Representative Weiler, and don't let me forget we got a member in the crowd.
I would.
Oh, it looks like you took your hand down.
Chair, I would suggest that the motion or the amendment to remove it is for further discussion. So that it's obvious we haven't killed it. We're just removing it for further discussion. That's all. Thank you.
All right. If you want to bring in whoever our guest is that wants to speak on this.
Sure.
Good afternoon, Mr. Chair. Mike Skibby from the Disability Rights Center. I just wanted to make a couple of quick comments. I think the 25-bed census amount made a lot of sense when it was in the last budget, or should I say the current budget, because that basically covers the civilly committed population that has now been transferred to the secure psychiatric unit. I think there's pretty general consensus that that census amount would take care of basically removing people from the prison who have not been sentenced, but are more properly in a more civilly appropriate therapeutic environment. I think that if you do go up to 60, then you are definitely creating a net increase in your hospital capacity. And I think there's pretty good evidence that you don't have a problem of bed capacity. You have a problem of using your bed capacity basically to house people who are ready for discharge. I think that you've probably already heard from a number of people that you've got about half your beds at New Hampshire Hospital are being held by people who are ready for discharge. And I think that that's a problem that you're not going to build your way out of. You need to deal with that problem with a much less expensive enhancement to the mental health system, which is to create discharge destinations for those people and to create supports in the community so that they don't need to come back pretty quickly after they were discharged.
May I ask you a question, sir?
Certainly.
Do you think your organization or you have had an opportunity to fully provide testimony to a policy committee on this topic?
It's never been before a policy committee, but I certainly spoke at some length on a couple of different occasions before Division 3 and the full House Finance Committee when the current budget was being prepared. And it was after that sort of back and forth that the current provision was adopted, which provided for 25 beds, which basically takes care of the actual problem, which is that you've got people at the secure psychiatric unit that shouldn't be in that environment. But I'd be happy to go over those issues again. Basically, my testimony would reference independent assessments of the problem in New Hampshire, one of which was a report in 2017 that was commissioned by the department itself. And another is the periodic reports of the expert reviewer who analyzes whether the state is in compliance with the community mental health agreement.
Okay, so I do have one other question for you. I understand your point about going from 25 to 60 with that 35 bed extra capacity. It would probably still get filled up because we don't have the community-based alternatives to discharge people into. But wouldn't that 35 also, though, absorb more people and get more people out of the emergency room warehousing?
I think that the dynamic is one that we've seen repeatedly, which is that when you take out people from the hospital, it's basically the same thing as adding a bed, right? And so we've done that before. We've created transitional housing and transferred a couple of dozen people at times out of New Hampshire Hospital, but those beds don't remain in play. They basically get filled up again by people who are not ready for discharge, that are ready for discharge but don't have a place to go. And we've seen it most recently with the creation of the 16 transitional housing unit beds on the campus at the old Philbrick Center. I mean, I think probably the most helpful analogy is a simple one, but I think it applies, is that, if you have, a bathtub of a particular capacity that keeps overflowing because your drain is running more slowly than your faucet is, then you can take a few buckets of water out of that bathtub and it'll stop overflowing, but only for a brief period of time before the inherent problem with your system, which is that the drain isn't running fast enough to keep up with the faucet, is going to overcome the capacity again. And the same thing would happen if you added a net of 35 beds to New Hampshire Hospital. If you don't have places to discharge people, then you're going to fill up those beds again, and you're still going to have this problem. I mean, we've had a net increase in beds over the last couple of years in New Hampshire, and we've got a larger boarding population today than we did 12 months ago, and maybe 2 years ago. I'm not exactly sure what the count is compared to 24 months ago, but we've definitely seen those two things running in opposite directions in recent months. And so I think that's because of what I said, which is that your problem is that you're not discharging people as quickly as you're admitting them. And so you've got people backed up at the front door.
Okay. Well, thank you. Representative Irf, do you have a question for Mr. Skibby or just in general?
No, I do have a question for him, yes. So it sounds like you're saying the problem can't be solved. So what is the solution? Because I was listening to you 2 years ago, so I recall the whole conversation about transitional housing, and as you say, it's some of it has been built. But if that hasn't helped solve the problem, what is the solution?
Well, transitional housing, if it's used truly to transition, that is, somebody is there very briefly before they're moved into a more permanent living situation in the community, then transitional housing can be part of the solution. But the real solution is that you get people out into the community to permanent places to live, and you keep them stable in those permanent places so they don't show up at the front door again. I certainly didn't mean to say that the problem can't be solved. The problem can be solved by coming into compliance with the mental health agreement. That is, by providing the community supports that the state agreed to provide. Because we know that when you do that, people don't show up at your front door again. And also by providing other supported housing that keeps people permanently and more stably living in the community. You can keep building beds, and eventually you'll have every mental health patient in an inpatient facility, and you'll stop, having them in the emergency rooms. But you're going to be talking about a lot more than 35 beds before you solve it that way. The way you need to solve it is that you need to have your throughput working. That is, you have all of your beds filled with people who need an inpatient level of care, not have half of them filled with people who are basically living there waiting for a permanent place to live.
Are there other questions for Mr. Skibby or just in general? Okay, I'm not seeing any. I have a question for you, Mr. Ripple, and maybe for Chairman Weiler too. Do we think we have Finance Committee obligations, the whole committee, on April 5th or 6th? That's Monday or Tuesday before our 3-day House session?
I'm not aware of any. Just take a quick look at the calendar here.
I'm wondering if we should block or if Division 3 should anticipate that the Monday or Tuesday, the 5th or 6th, if those are full finance days, or if we could maybe hold a public hearing on this HB.
I doubt you would have, I doubt full finance would have anything going on those days, since it's reporting its bills out by the 1st.
Do you agree there, Chairman Weiler?
Yes, I think we could have a hearing, or maybe even before the full committee.
Oh, you want the full Finance Committee maybe on this?
Well, if it worked best for the schedule.
Okay, so I'm just looking for a sense of Division 3. Is the Monday or the Tuesday, the 5th or the 6th better? We could go ahead and try to start a scheduling to make that. Yes, Representative Waller?
I was just gonna check with Representative Weiler. What day will you be doing the briefing for the full House around the budget?
I haven't really scheduled that yet. I think I had a tentative date here.
The only thing that bothers me about doing it on that Monday or Tuesday, when on Wednesday, you're gonna have the budget on the floor.
Right.
And there's a lot of preparation work people have
All
to
of
do
us.
to get ready for that. I mean, those seem like to me like days you might have caucuses, you might be briefing your caucus, we'd be briefing ours.
So let's jump ahead and assume you're absolutely correct. It then seems like we should go ahead and wait until the 12th or 13th, that Monday or Tuesday, to get it past our House sessions. So of those days, the 12th or the 13th, Monday or Tuesday, is there a sense of what the division would prefer? I don't care. So if anyone has a strong, don't do it on this day, this is a good time to speak up.
Well, I was kind of waiting for the divisions to finish before I tried to schedule the full committee, and I was hoping that would happen, within the week. And I could possibly have it like the end of March or even the 1st of April.
Yes, sir. I think if we move what we're talking about, the review of this House bill,
Yeah.
Section 39, to the 12th or the 13th of April, though, we're just clearing the deck for you to pick when you need to pick. And then we're also giving room for Representative Wallner's concept that we've got a lot of homework to get ready to talk to the full House.
Well,
So-
she's correct.
Yeah, okay. So I'm not hearing anyone complain about either the 12th or the 13th.
Representative,
So-
may I offer a piece of information?
Yes, ma'am.
I do believe that the Senate Finance is going to start meeting on the 12th. I don't believe that they're likely to meet until the afternoon, though. So maybe in the morning of the 12th might be an option. I think the House Finance presents to Senate Finance on the 12th potentially, but not till the afternoon.
Okay. Whatever we find on this House Bill 2 item, I don't know how it works. I think we'll be informally communicating to the Senate in any case, but or through Kevin, except Kevin can't be in two places at once. Maybe that's what you're saying. Mr. Ripple, do you know what you're doing on the 12th?
Well, I'm taking a look at the Senate calendar now. So no, off the top of my head, I'm not sure.
Okay. So if you would take a note to maybe pencil us in for Monday, the 12th in the morning on the idea that the Senate finance people won't start till the afternoon. Then we can have a morning hearing on section 39.
Okay.
All right. And then I think we would like to, on Thursday, have a vote of Division 3 on an amendment to strip section 39 out of House Bill 2. Do I need to give you something in writing for that?
Nope, you don't. We can just have it drafted to remove that section.
Okay. So Representative Wallner, since this was your topic today, are you satisfied with where we're at, where we're going?
Yes, I like the idea of us having a more open discussion where public can come in, where other people can come in and talk to us about this. I think it's good.
Okay, good. Good. With that, Representative Earth, why don't you educate us? Tell us what you've done with House Bill 1 and do your intro with us. Does anyone need a few minutes break before we get into that? I think I actually could take a minute or two. So while you and Mr. Ripple get ready, I'm going to step away for a few moments.
Okay.
Go ahead, Representative Weiler. What?
They would like me to appear at eDNA at 3 o'clock. I'm still not sure for what. But if we're
Okay.
not done by then, I'll step away a few minutes before.
Yes, sir. I think we're going to be done before 3.
Thank you.
So Kevin, if you could bring up the draft funding analysis budget that's dated today,
Sure.
just a single page.
Yep.
And everybody should have a copy of it that I sent out this morning. Can you all see that okay? It seems kind of blurry.
Very blurry.
But my original is very clear.
Yeah, unfortunately, I'm not sure if there's anything I can do anything about that because it does look clear on my screen.
Can you maybe blow it up a little bit? Then that might help a little. There you go.
Oh, it's better. That's better, Kevin.
Okay.
Now you don't have to go too far. Yeah, most of what I'm even talking about, Kevin, is at the top anyway. So
Okay.
Okay. So I'm back. Harry's not here. Representative Nordgren's not here.
There's here.
There's Representative Bean. So we found a Bean in New Hampshire that's not related to you, Harry.
I wouldn't bet on that yet.
I think we should wait for Representative Nordgren before you launch into this.
Yeah, no problem.
Can you see that?
I do. I can't read it, but I can see it.
John Bean, or Jim Bean, or John Bean. Move it to your left a little. There you go. From Exeter.
See how thick that is?
That's a lot of beans.
A lot of beans. That's why it take me a while to figure out if she's actually in there, but she's probably married to, that's probably her married name as a guess. I mean, I don't just guess.
Have you sent out, Keith, have you sent out the line by line that you use to build this?
I have. Kind of, yeah.
Okay.
Unintentionally, but I did send it out when I meant to send this out. So they have both.
Okay.
Everybody has both.
So Mr. Ripple, while we're waiting for Representative Nordgren, I got a question for you.
Okay.
Okay, so this document that Representative Erf has created to explain to us what he's done is really the summary of a tremendous amount of line by line work that he's done. That line by line work that he's done is kind of a process document. It's not a final document. To what extent should we use, are we obligated or is it appropriate for us to share publicly that line by line that we know isn't the final document? It's just a way for us to work and communicate.
If it's a proposal that you and Representative Erf are willing to share, I don't think there's any harm in sharing it.
I don't really care to, because I know it's going to change so much. I don't want to create anxiety over what's just an internal temporary working document. So if I don't have to share it, I don't want to.
I don't think you have to share it. I mean, to some extent, it's been emailed out to the division as a whole. So
Yeah.
it's up to individual members to decide what they want to do with that. But certainly it's not something that I don't we need to add it to the website just because it's been, well, I need to think about that.
All right, please think about that. And,
Sure.
and Ms. Rounds, did you get a copy? Because we wanted to make sure we copied you on the line by line. So just so you know what we're doing.
I did not.
I'm sorry, Mr. Chairman, I did not realize that, but I would love to give her one so that she could tell me everywhere I went wrong. I'm sure there are many places.
So we are now back, and why don't you go ahead and tell us what's being shared here?
Okay. So the chairman and I were trying to come up with a place to start to go forward in this process. And we kind of divided things globally at the start. I was looking at the numbers and the chairman was looking at the staffing. So I'm going to start with my piece. And the idea was to start with the fact that we all have to work with the Ways and Means revenue numbers. And those are we have to respect that process that kind of begins at that point. And we also needed a good solid foundation to build from. And it seemed like the obvious choice there was to start with our current FY21 budget and use the adjusted authorized numbers, since that seems to completely capture, as Kevin pointed out to me, not just what was in HB 3 last current biennium, but also what was in HB 4. So the second to the left column, the kind of, I don't know what that color is, but whatever that color is, it says current biennium baseline at the top. That is, those numbers represent the FY21 adjusted authorized values for both federal funds and general funds. So that's the foundation that we wanted to build on. So then looking towards the top of the middle part of the document there, we're starting in some ways, you could say, from the governor's proposed budget. So his numbers are up there as well. And of course, as we're all aware, he started with higher revenue estimates. So we need to basically come in below that with the Ways and Means number. But rather than kind of building down to it, we thought it'd be better to try to build up to it. So starting with the FY21 adjusted authorized budget in conjunction with the governor's budget, I worked to develop what I'm calling a zero base starting point. And Sharon, go ahead. I just feel free to interrupt me.
You're doing great.
No, she has her hand up.
To figure out when to have Representative Nordgren interrupt you.
Yeah, no, have her start right in.
Thank you. I think Chair Weiler was going to have a discussion with Norm Major in Ways and Means. And I know there's been some discussion with them revising or relooking at their revenue numbers. I was just wondering, as a basis for our conversation, if that's happened. Thank you.
So go ahead, Representative Weiler.
At this point, he hasn't given me anything, but we're gonna meet, and that's all I have so far. So nothing concrete that I can go from. Thanks.
However, in response to Representative Nordgren's point, it works actually quite well with the process I'm describing. Since what we're hoping to do is to build upwards from a base, and we can keep building upwards, as opposed to working down and then back up and then work around like that. So I think you'll see that this fits with the model of, if the Ways and Means revenue numbers either go up or down, we'll be able to work with that. So the process I went through was to take these two budgets, the FY21 adjusted authorized, which I'll start referring to just as FY21, but that's what I mean when I say FY21. Combine that base with the governor's budget, which I was viewing as the spreadsheet that we all received in addition to the monster PDF book that showed his budget as well. And I just did a really simple, and it was just a numbers game. I wasn't playing anything with what was going on. I was just looking at the numbers between those two budgets. And when things were kind of like we did this morning, when we were talking about federal funds quite a bit, if a department had only federal funds, I just took those over from the governor's budget, figuring that they probably were the most current, and Karen had, they all worked basically for the budget going forward, and worked in light of any changes that might have taken place in federal funds requirements and that sort of thing. Then I looked at comparisons. So if it was more than just general funds, I also looked at the general funds. And if the general funds in the governor's budget were lower, I would also move the governor's budget over. Again, the thinking was that his budget was more current with the department's thinking. So I was biased towards trying to support that current budget where it made sense. And I also looked at even in cases where there wasn't a big difference. So general funds were maybe a couple $100,000 more in one case or another. And then I'd bring the same thing, I'd bring over the governor's budget. Where the current budget, the current FY21 numbers, not budget, numbers, were lower, I would bring those over in their place. So that's what shows up between the two bluish type boxes for federal and general funds there for the first year. For the second year, at this point, I did not build any increase in. It's just a duplicate of the 22 year, excuse me. The 23 year, just the exact duplicate of the 22 year. And since we needed to know where we were, how much room we had to build up, I was looking at everything as a reduction from the governor's budget. So that's all the negative numbers that you see on there are the reductions from his budget from which we can build or build into, if you will. And you can see the total there is that really wildly bolded, bright red number, about $160 million. Well over the amount of the current Ways and Means numbers requiring us to work towards. But again, as I said earlier, to the extent that those numbers increase, then we can move further up the scale, so to speak. So just make sure I haven't missed anything here. Yeah, I think I've covered what I wanted to cover regarding this. Are there specific questions on anything I've laid out there?
So I would like an opportunity to restate what I think you just said, but to sort of say it in my way to make sure I'm understanding where we're all at. That this document that you've put together is not anyone's budget proposal. What this document is it establishes a baseline for the Division III folks to work together to say, we can go through the line by line and look at the programs, and we have money that we can add back to this baseline. And the reason we went with this approach is because early on, we took a look at the simple fact that the governor's budget was based on a higher revenue estimate than what Ways and Means came in with. And so we had a meeting with the governor's office and invited them to work with Division III to identify places that we may reduce from the governor's budget so that we could stay within the Ways and Means estimate. And they were very courteous, but they basically said, we believe our revenue numbers and we've given you our budget, and you know, the House is going to have to do what the House is going to do, but we're really not going to do anything to help you with that reduction process. We may answer questions if you ask us specific questions. So at that point, it felt to me like we were a little bit on our own, and we needed to find a way to have a conversation. So we wanted to get down to a base to where from that base, we could go program by program, line by line, and potentially add some money back. And the question was, what's the base and what's the amount that we could potentially add back? And that's where Keith has been invaluable. He went through, he looked at the governor's budget compared to the FY21. Whichever number was lower, he took. If the governor's budget was within 200,000 of an increase, he took the governor's budget increase of about 200,000. So he took all of that math, and that's where you get to the $7.7 million. That if you take Keith's view of a baseline, the first year generates about 7.7 million for us to be able to potentially add back. Now, Keith, this is where I'm getting myself confused between the 7.7 and the 54.2.
Okay, do you want me to pick it up?
Yes.
Okay. So the first thing I did, which is what the chairman's referring to, are the top two lines there. That is simply comparing the FY21 budget as it is, as it stands, to the governor's budget as provided to us. And
Okay.
that's where those, so just comparing those two numbers, the governor's budget is about $7.7 million in the first year, higher than the current FY21 budget, FY21 expenses.
Yeah.
And in the second year, it's about $58 million higher than the current year's budget, for lack of a better word. And I'm sorry, go ahead.
I'm back to understanding where we are. So the total of the baseline that Representative Irf came up with by following this algorithm, which was whichever is lower between FY21 and the governor's budget, take the lower number, with the exception of if the governor's number is $200,000 or less of an increase, go ahead and take it. So that algorithm led him to an $835,568,000 baseline. That is not our budget proposal. By taking a look at that 835, it looks that we have about 54.2 million that could be potentially added back. Now that 54.2 million.
In year one.
Pardon me?
In year one, that's just in year one.
In year one, still has to pay back the fact that the Ways and Means budget or estimate is less than the governor's. So we don't get all 54 million to add back. It's going to be some number that we work out with Mr. Kane and the chairman, but let's say it's half of that. So we have about 25 million of that 54 that we can add back in year one. And in year two, year two is 105.12 million, of which again, about half of that we can probably add back to that FY23 number. So it's the add backs that I'm hoping that we have some common ground on. Representative Wallner.
This is more for a question for Chairman Weiler, I think. So I was never really clear exactly how much below the governor's estimates, the House estimates were, and how you had apportioned that per each division. So I wondered if you could explain to us how much each division, or maybe you didn't assign each division, maybe it was some other formula or something. So I just wondered how much was Division 3 supposed to be reducing the governor's budget by?
You're muted.
Yes, Representative Weiler.
Answer? Thank you. So the initial thought was it's like $70 million difference between what they delivered to us from Ways and Means and what the governor's budget looked like. And we had a discussion about that, and we looked at how much the increases had been year over year. And the biggest increase was in HHS, not so much in the other divisions. Education had actually come down quite a bit, and the departments that were in Division 1, not a big change there. But the biggest change overall was HHS. So it occurred that was where there was the most room, especially from our discussions. They'd had this huge increase from 21, which they still hadn't been able to fill the jobs. They had the money on the books, but it hadn't been dedicated to employees or anything at this point. So there seemed to be more room in Division 3 to take the largest part of the reductions. And so I did get, I think, about a 17 or 18,000 out of Division 1, and maybe only a couple of thousand out of Division million, about 18 million out of Division 1, and maybe a couple million out of Division 2. And she said that's all she could do. So Keith took on this project and said, well, you know, this was this huge increase, 24% from one year to the next, from 20 to 21. And they really still haven't caught up with it. So there's capacity there that we're not hurting anybody or any program if we take a cut of where the money hasn't already been promised anything. So that's the way we proceeded. Thank you.
You have a follow-up, Representative Wallner?
Just let me see if I follow. So Division 1 had an assignment of about 18 million. Division 2, it sounds like, was only a couple of million. And Division 3 must have been 50 million.
I never really assigned it. I just asked them to take a look and see how much they could cut and come back to me and see what you could do. And Division 2 said, this is going to be tough. I don't think I can take away much of it. Division 1 said, you know, a lot of mine is the interest on the treasurer's office, that's general fund. And you know, you can't reduce that. So once we started looking at details of where the money could come from, there weren't many places that, you know, that had gone up with the same increase that was from 20 to 21 in HHS. So as I said, that's why it looked like there was room there to say, okay, you were given all these programs, but you haven't done anything about them yet, or you haven't found the people yet, with hiring freeze or whatever else, unavailable people, so that we were hurting them the least by making the cuts, because it was cuts to program that hadn't even started yet.
Thank you.
Representative Nordgren?
Thank you, Mr. Chair. So I guess the lurking question for me is, whatever happened to all the money that the department lapsed? And we know they lapsed millions, and I'm just wondering how this fits into Ken's equation. Thank you.
So because I'm less familiar with the history and the jargon, let me ask for clarification. When you talk about lapsing, are you referring to FY 20, FY 21, or a combination?
A combination. We know that we budgeted money they didn't spend, and it was millions of dollars. I was just wondering how that figures into what we're supposed to be cutting out of the budget proposal in front of us. Thanks.
Sharon, Representative Nordgren.
Well, I actually think I can handle that.
Okay.
Okay. So the FY 19, we don't see FY 20 on this sheet, but the FY 20 number was pretty solid because the books got closed on FY 20. The books were also closed on FY 19. But to get to the FY 21 number, we went from 750 million to 882. Because as we've been listening, they have these fairly significant vacancy rates. You can, and given how much money goes into the personnel line and the benefits line, there's probably a really hefty lapse getting teed up for FY 21. And I don't know if the department has an estimate of how much they're going to lapse in FY 21 or a historical number for FY 20. And so, Ms. Rounds, if you have answers to those, that would be responsive to Representative Nordgren's number or question.
Sure, yes. So I provided the lapse information for fiscal year 20 and our estimate for fiscal year 22 on Saturday. So I'm not sure if Kevin's had a chance to get all that information out to you yet. Our lapse for fiscal year 21, there was a further question. So fiscal year 20, I provided it by division and class line. For fiscal year 22, I provided a higher level estimate because, of course, right now it's based on estimates, on projections that are still in flux. But our lapse will be at least $75 million. And I was estimating that about 25% of that was potentially from personnel, which is about 18 million.
So twice you said FY22 estimate.
I'm
but I think-
sorry, 21. I'm sorry. I'm jumping
No,
ahead a year in my brain.
Yeah, so you gave us an actual for FY20 and you're
Yes.
estimating for FY21 about a
Yes,
$75 million lapse.
correct.
All right. So
At least I would say at least a $75 million lapse.
Representative Weiler, your hand was up. Is that from the last one?
Oh, I had a question for Ms. Rounds.
All right.
In this last budget, some years we have given you an assigned lapse percentage of your budget. Did we
Yes.
do it in this last budget?
You did. I'm going to look up because it's so important to what Mary and I consider when we're managing everything that I actually post it on the board above my monitors. So our lapse target for fiscal year 21 was $33 million. So we're going to exceed that by at least $40 to $50 million. So if I may, do you mind if I just add something to that also a little bit in response to what? Okay, so Representative Norgren was asking about lapses, and I think maybe part of what she was getting at is what is the lapse target for 22-23? I do know that across the state, if I remember the governor's budget correctly, it was something like 2.5 or 3%. So I do know, and this may be what Representative Weiler was getting at, there have been previous budgets where the appropriations are not reduced directly. However, the lapse target is increased and the department is instructed that their lapse must be at least X amount. And then we report on that. I'd like to say monthly to fiscal, but you all know that I have a terrible track record with monthly. It's more like every other month, but I do report to fiscal committee on where we are with the lapse target. So that is something that has also been considered in the past.
So Representative Weiler, you're sort of in a follow-up mode if you have one.
No, I think that was the information that I discussed with you the other day about lapses and assigned lapse rates and so on. So I just wanted to bring that all up for anybody that didn't know it before. And you know, it's a typical thing, like Ms. Round said, 2.5 to 3%. Everybody's expected to lapse something. And with the events we'd had in this previous year and a half, the lapse we can expect to be greater.
Thank you. Representative Wallner and then Representative Nordgren.
So Karen, there was a back of the budget reduction in the bill in the previous budget of 25. I think it was 25 million. Were you able to take that off from the first year of the biennium?
Correct. So the lapse information that I sent over Saturday, I want to say our expenditure lapse was like 30-ish million, and then our revenue lapse was another around that amount. So our total lapse was about 50 to 60 million. So we talked with the Department of Administrative Services, and the commissioner indicated that our lapse could count towards that back of the budget cut. So we consider that back of the budget cut satisfied in fiscal year 20, because our lapse target for fiscal year 20 was 26.67 million. So we definitely exceeded that by at least $25 million.
Okay, so you lapsed 60.
It was around that, yeah.
You paid 25 million for the back of the budget.
Yes.
So that left you 35, right?
Yes. And our lapse target was 26.67.
Okay, so you had 35 and then your lapse target was 26. So you had about 10 million that you exceeded it.
Correct.
Is that right? Okay.
Yeah.
Thank you.
You're welcome.
You have a follow-up?
No, that's what I wanted to know.
Okay, Representative Nordgren.
Thank you, Mr. Chair. So maybe I missed it, Ms. Rounds. What was the governor's lapse that was presented for you in the budget he proposed?
For 22-23?
Yeah.
Oh, So I would actually defer to Kevin on what the percentage was. They didn't split it up between departments yet. They usually don't do that until the budget is passed. So Kevin, I don't remember if it's 2.5% or 3% of total general funds.
Yeah, the total statewide lapse for all departments was between 2 and 3% in the first year and between 3 and 4% in the second year. The figure 67 million statewide in fiscal 22 and 92 million statewide in fiscal 23.
Thank you.
So did you just say 97 million plus 56 million or something like that? So it's a total of like 154 million?
67 plus 92 is 159, yeah.
Okay. Which is kind of coincidentally a number that's on this spreadsheet, but that's just coincidence. Okay. So, so Representative Weiler, I want to come back around and just make sure I'm clear on something you said. It sounded like you were comfortable with the idea that Division 3 would need to handle 50 million of the difference between Ways and Means and the governor's revenue estimates. But that 50 million is between the 2 years of the biennium. It's a total of 50 for the 2 years.
That's correct.
All right. All right. Sorry to ask the basic questions like that. I just don't want to get off. All right. So at this point, I'm hoping that the committee members understand what Representative Earth's summary sheet means. It means that between the 2 years, if we use the baseline he came up with, we've got a significant amount of money, about 150 million that we can add back on a line-by-line basis based on our understanding of program priorities. And Representative, well, let's ask Ms. Rounds first in case you're going to make us smarter. What your hand is up. Did you want to say something, Ms. Rounds?
No, I forgot to take my hand down. Sorry.
Representative Wallner?
Well, I guess what I'm wondering is, I'm clear about what the chairman expected us to do was to reduce the biennium budget by about 50 million in general funds. So now I feel I'm clear about that, because up to this point, I didn't know exactly what that target number was. And I guess I don't understand exactly why we go to this sort of complicated system here of taking away and then adding back. Why don't we just look? I mean, this looks like it would be something like, I'm sure it doesn't just break down evenly, like 25 million the first year and 25 million the second year, but I can't understand why you wouldn't just work towards where you would look for those reductions. It seems like it would make it almost easier to understand than taking it all away and then adding it all back. Seems like a lot of extra steps, but maybe Representative Earth can clear my thinking up.
Well, to be fair to Representative Earth, this was my brainchild for the most part, and not his, and he's just been doing the Excel sheet, not just the Excel sheet, but he's put a lot of time and thought into it. So, but if there's anyone to fault for this approach, it's me, because I wanted to get down to a true base so that as we add back, I think the process of adding back is an easier conversation to have than trying to go through looking for cuts. Because every conversation starts with, I want to cut this, I want to cut that, I want to reduce that. And this way we're flipping the conversation to say, okay, using this baseline, where do we as a committee see our priorities? And our priorities could be in sync with the governor's priorities. It could be in sync with the department's priorities. It could be in sync. You know, it's really up to the committee, I think, now that we have a solid baseline to begin to add back. And I don't know if that's a satisfactory answer, but that was kind of the thought process.
I'll take a crack at it, Mr. Chairman.
Sure.
Kevin, could you put up just like the first page of the other document I sent you?
Sure.
Thank you. Okay, so this is what I also sent to you this morning. It's basically just the same spreadsheet that I've been working with, and you all, I'm not sure which way you work with things, but it's basically the raw data with the addition of the baseline numbers that we've been talking about. And I guess to address your question, Representative Wallner, I think it's kind of 6 to 1, half a dozen of the other. So what I've done in this very rightmost column here, where what you see is cyan. If you scroll up a few pages while I'm talking, Kevin, eventually you'll come to a different color. I think it's like a pink color. So they'll see what I'm talking about. So that color distinction distinguishes between, this is for every department, whether it's a governor's budget, which is what the cyan blue represents, or a FY21 piece, which is what as if you keep scrolling, you got to keep scrolling, that cyan will change to a different color. It's quite a ways down there before you get up. There you go. So go back up a little bit. There you go. Stop right there. So there's an example of what came from FY21 as opposed to from the governor. So essentially, as we were discussing this morning, we were talking about, okay, which are the easy accounts to just say they're good. So that'd be really easy. We just check them off on here. And we do that with everything, which is all the accounts, no matter where they come from, are good or bad. So instead of thinking from the point of view of the governor's budget, this gives us the opportunity to look at, as the chairman was kind of pointing out there, maybe there's areas of his that are not necessarily our priorities. And we might want to, or even the department's priorities, where they've been talking about some things that they may have wanted more. So it's not to say, I didn't want to assume that the governor's budget was what we wanted, absolutely. And all we had to do was take a few things away from it. I thought it would be better, and I should say we, because Jess and I spent a lot of time talking about this. We'd be better to try to build up with using our priorities. So that was sort of the thinking. And I didn't think it'd be any harder one way or the other, since we have to look at every account anyway, pretty much. I'll take my hand down, sorry.
So Representative Wallner, did you have a follow-up or is your...
I did. So how, using this method, we've heard from the department about a number of items that they had as priorities, but they did not get included in the budget. So how would we take those into, where do those show on this kind of a document?
They don't show yet. Because the whole point of this document is to get us down to a baseline, to give us some idea of how much we can add back. And then of the amount that we can add back, we can begin to target it in a way that makes sense to the committee members.
I wonder if we could have some sort of a column or some sort of a way of looking at those priority requests that we've heard, so that as we're looking at a certain area of this spreadsheet, we can also see the priorities that the department has laid out for us that they had not gotten included in the governor's budget.
So that's a request that neither Representative Irf and I have made at this point. I have assumed that as we go through these line by lines, we'll have our notes with us and the briefings that they gave us, and we'll be able to look at that information. But if you would like to make a request to Mr. Ripple and to Ms. Rounds, I'm happy to let you do that and hear what they have to say.
Let me just ask, do we probably do, you're going to tell me we have this and I'm going to say, where is it? Do we have a document from Ms. Rounds that has all of the priority requests?
You should have that. I believe I sent it out, and it's also on our website. I don't remember which number it is off the top of my head, but yes, it is.
Okay, so we do have a document that lays them all out. Okay, thank you.
Is that document in the same sequence as these line by lines, or in a different sequence to where we still have to do one of these mix and match things?
That I'm not sure.
I think they're by agency number. I don't know if they're in the same accounting unit order. The other question I would have, Representative Earp, when you did this, did you also look at the 3,000 line spreadsheet that I provided that had actuals for 18, 19, and 20, and then had explanations for why things changed for every class line?
Well, if you're asking, do I have all those numbers? The answer is yes. Was I focusing on those and putting this together? Not so much.
Okay.
I also would want to clarify that there's the governor's letter that came out recently with your priority list. And then I guess there's your own priority list. But one thing we don't have is the whole priority list, starting from the beginning, because really that's what matters, right?
That's what Kevin's talking about. That is what I provided.
Okay, I have not seen that. I've only seen the governor's letter that showed another, whatever it was, dozen or so things he wanted to add in on top of this. So maybe that's in that list I just haven't gotten to yet. And by the way, the lapsing stuff, while I'm familiar with it, that only came out on Saturday, just so you understand. I really didn't, I've been working on this for several weeks. I didn't have a chance to incorporate the lap stuff. I apologize for that. But I'm glad to try to add another column in for the priority stuff if that's available.
Okay, so we still have Representative Wallner's hand up. I don't.
Oh, I'll take it down. Sorry.
Representative Weiler.
I was just going to add, Representative Walnut questioned the process of why didn't we go through line by line? And I remember doing that in the past, and it started off, okay, we got to reduce this by so much. And the first few you'd reduce quite a bit, and then you didn't reduce enough, and then later on you'd say, oh, we didn't reduce enough. Look, we're halfway through and we haven't reduced it in half. So you start reducing more. But this way you started with everybody on an even level. And then you could talk about going back without doing the way we sometimes done, going line by line, looking for reductions. So I didn't think that, I thought this was a superior method. And I congratulated them on it. Thank you.
Representative Nordgren.
Thank you, Mr. Chair. This question is directed to Representative Weiler. I was wondering if maybe we could tell Division 1 they need to take more than 2 million out of their budget. It seems like they got to decide what their number was, and I didn't get to vote on what our number was. Just thought I'd ask. Thank you.
No, it was Division 2 that only took a couple million out. Division 1 took about 18 million out. And that seemed like a fair amount for them. The other thing that we run into is since the gas tax revenue is down so low, the last couple of budgets, I think we've had to take money out of general funds and put it into highway funds. Fortunately, Fish and Game, we didn't have to do that. Previous budgets, I think we've given more money to Fish and Game from the general fund. But I think a fair amount of money had to go to highway fund because they're not earning the money, and the costs are still going up for paving and employees and so on. So they're in a tough spot because of the revenues they're dealing with that decline and have to be filled in by general fund. So that was understood when looking at their figures. Thank you.
So if I could, I'd like to take another crack at partially answering Representative Wallner's question about this, the method, the reason for this approach selection, and that is that there was a significant amount of growth between FY21. No, wait a second. Let me get my numbers right. The previous budget ending in FY19 and the current budget ending in FY21, there was a significant amount of growth in there that the department had not been able to internalize. And a lot of it was because God struck and we had the pandemic and we had a hiring freeze. And so, but a lot of the growth that was projected from 19 to 21 for a number of reasons just hadn't happened, whether it was the pandemic, whether it was working or worker shortages, whether it was because the leadership was so focused on dealing with the pandemic that they weren't also able to focus on other things. It was hard for me to look at the governor's budget and wrap my head around all of the things that maybe really hadn't happened or only had happened to a partial extent. And so what I thought would be helpful would be to get us down to a solid level base so that we could begin talking about what has happened and what we would want to resource to have it continue to happen. So I don't know if that's helpful, but that was part of my thinking at the time. All right. I think where are we? We are at the point where I had thought maybe we could do a conversation around which items we think we could, or which activity codes that I thought we could agree on quickly so we could just take them off the plate. Earlier, we had talked about just accepting all of the funds or all of the accounts where it was federal funds only. Just go ahead and have Mr. Ripple move those off to the side and we'll quit talking about them. That was one category. And then earlier today, Representative Nordgren sent a couple of activity level, like the health equity line, the office of the commissioner line. But that was before we had an opportunity to describe this baseline approach. So if you guys want to go back and double check that those are easy to do approvals, then we can do that on Thursday. But is on this idea of just basically accepting all of the accounts with federal funds only, is there anyone that disapproves of that? No, I don't think so. So I think Mr. Ripple, it's kind of obvious, but Ms. Rounds and you and everyone can just anticipate that all the lines that the federal funds only, we're not going to be coming back to.
Okay, so I'll provide you a list of all federal funds only accounting units that you can then take a formal vote on in a future meeting.
Yes, please. I think that would be helpful. Okay. I think we're through with the agenda that we had for today. Representative Weiler wanted to finish well before 3 so he could get ready for his next meeting. Or is it for the good of the committee? Are there just any general comments? We've sort of done a bunch of different things today. And so if there's anything we've done that you want to revisit or prospective things, this is a good time to throw them out. Representative Nordgren, you've been down this path before. Are we on track?
I'm still not sure I understand your whole plan of how we're getting to where we're getting in the end. But I'll await more instruction. Thanks.
Okay, so if we were just sitting in the same room together, what I would do is I would pull out with you, I would pull out the line by line Excel sheet that Keith is sending us all or has sent us. And in that, you would see what he considers to be our baseline. And if you like that baseline that's in there, then we can just all agree to that probably. If you think the baseline is too low and you want to add back on that line, that will be a discussion for Thursday and later. So it's you now, I think, are empowered to take the line by line and say, okay, accounting code 5608 or whatever it is, 5608, general funds are 100 million. I want it to be 102 million. And that's where we'll be talking. Is that a little more clear? Okay. All right. And as you're actually doing it, if you have some questions, just give me a call or give Representative Urf a call. He's nothing but supportive when you call him on the phone. Are there any other comments or questions? All right. So, Mr. Ripple, what have I forgotten?
I don't think you've forgotten anything. I think that was the whole agenda for today.
Okay, so we're going to get together at 9:30 again tomorrow. And the Republicans, just for transparency, we have a GOP caucus at 5 p.m. And Representative Urf has sent out a Zoom link. So, all right, well, that's all I have. Thank you very much. And with that, I think we can adjourn for the day.